Good morning. My name is James Valentine, and welcome to the externally led patient-focused drug development meeting on hypophosphatasia. I'm here in the studio with my co-host Deborah Fowler, the president and founder of Softbones, and we're coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the U.S. Food and Drug Administration's headquarters are located. It's my pleasure to turn it over to Deborah to provide some opening remarks.
Thank you, James. And thanks, everyone. Hello, HPP community. As James just said, my name is Deborah Fowler, and I'm founder and president of Softbones, the U.S. Hypophosphatasia Foundation, and mom to a 17-year-old son, Cannon, who was diagnosed with hypophosphatasia at 18 months old. Our vision at Softbones is a world free of HPP, and today we take a step toward that in better understanding this complex metabolic bone disease through this externally led patient-focused drug development meeting on hypophosphatasia. I'm so grateful that you joined us for today's meeting. A special thank you to the many staff members of the FDA who've taken time to join us. I know you're going to learn a lot from this incredibly brave group of people affected by HPP, their parents, spouses, and caregivers who are sharing their experiences, and we're excited to have you with us. And another special welcome to our sponsors who have generously helped to cover the cost of this meeting. Thank you to Alexion AstraZeneca Rare Disease, Purec, Rally Bio, Rampart, AM Pharma, Aruvant Sciences, and the Every Life Foundation. But most importantly, I want to welcome the members of this audience who live with hypophosphatasia. This meeting is about you, and it's for you. We started Softbones as a patient advocacy group in 2008 after my son was diagnosed, and I realized there was no formal organization dedicated to HPP here in the United States. At that time, there was no treatment. Today is remarkably different from where we were just 15 years ago. We have a bone-targeted enzyme replacement therapy on the market, and for many, this has been a life-changing therapy. Despite this incredible breakthrough for HPP, we still have our share of challenges. We want to hear from those of you who are on ERT, as well as those who are ineligible. We now understand that HPP is more than just a bone disease. Persistent low levels of alkaline phosphatase causes many other issues with organ systems that we're now just beginning to understand. HPP has been called the bone disease with the greatest spectrum of severity. What's so interesting, though, is that many of the symptoms are not related to bones. In fact, in a registry of nearly 300 patients, only half of them have bone-related symptoms. So symptoms of patients and their needs are incredibly variable. In addition, we have learned that HPP, as a patient community, has a concerning amount of unreported pain. Patients aren't adequately communicating this pain to their doctors, and many even go to great lengths to adapt or avoid pain altogether. It's not being appropriately discussed. Today is your chance to share your burdens and impacts of living with this disease. We are fortunate that researchers and the pharmaceutical industry have become very interested in hypophosphatasia over the past several years, with numerous research studies, several clinical trials in progress, and some planned for the future. Our medical need of additional treatments and eventually a cure for HPP is no longer just a pipe dream. This is why this meeting is so important today. Many of you will have the chance to share your stories directly with the FDA, explaining your symptoms and the disease that has the most impact on your daily lives. We're joined today by people from around the world affected by various forms of HPP. So often we hear frustration from patients that their doctors just don't understand or just don't listen to them. Today is your chance to be heard. We have so much to learn from you all, and your involvement today is critical. You'll have the chance to respond to a number of polling questions online and also make comments directly to the audience. And now it is my pleasure to introduce Dr. Patricia Beeston from the FDA, where she works in the Office of Tissues and Advanced Therapies. This is the part of the FDA that oversees cell and gene therapy. Dr. Beeston will share her perspective on ELPFDD meetings. Dr. Beeston, over to you.
Good morning, and thank you for that introduction. I'm Patricia Beeston. I've been at the FDA for 22 years and have worked in Centers for Drugs, or CDER, devices, CDRH, and now in biologics or CBER. Over the years, I've worked on different drugs, devices, and biologics for the treatment of a wide range of conditions that affect not only hundreds of thousands of patients, but also only a few. I've also had the opportunity to meet with patients and their caregivers to gain better understanding of their challenges and goals for their health and life. Thank you all for inviting me to be part of this meeting and for sharing your experiences with the FDA. I would also like to thank Deborah Fowler and all the staff that were involved in planning this meeting. As you can see from this slide, CBER is only a small part of the FDA, and we are located here in the organizational chart. CBER is committed to facilitating and advancing the development and timely approval of safe and effective biologics to improve the lives of children and adults with rare diseases. As can be seen by this slide, there's a diversity of products regulated under the Office of Tissue and Advanced Therapies. Asfotase, an enzyme therapy, was approved in 2015 by CDER for the treatment of children and adults with childhood onset hypophosphatasia. Currently, there are no approved CBER products for hypophosphatasia. Please be aware that we refer to all of the products listed in the above table as a drug unless this product is a device. At the end of this brief introduction, I will provide you with a link to clinicaltrials.gov. This resource allows you, the patients and caregivers, to search for clinical trials that have been completed, are in progress, or may be ongoing and recruiting. Please note that this list is not exhaustive because under the final rule, 42 CFR 11 that came into effect January 2017, only those investigators funded by the NIH or those wishing to publish trial information in the International Committee of Medicine journals to register trials involving human subjects are required to register. Nonetheless, this is a valuable resource for information. CBER considers the potential benefits and potential risks of every step of development, from the initial interactions with the investigators wishing to discuss their product through any application to put the product on the market. As would be expected, the number of unknowns is greater in first-in-human studies, and our understanding of the balance increases throughout the study of the drug. FDA works with the sponsors who submit applications to study the products in human subjects or patients to identify potential risks that can be mitigated through the product protocol design. However, not every risk can be designed out. This is important for patients and their caregivers to understand. Volunteering to participate or not is a big decision. It is important that you ask questions and discuss your concerns. Learn and understand to make the best decision for you and your loved ones. Participating in a gene therapy clinical trial for rare disease, you can contribute to the knowledge base and use of the investigational gene therapy for the product to treat your rare disease. And it is a gift of your time and more. So we want you to understand that gene therapy, while a promising and when making your decision, and that you communicate with us how you interpret these risks. We also want you to know that, the document
Well, thanks, Dr. Beeston. She's apparently having some technical difficulties, so we're going to move on. I'd now like to introduce Dr. Michael White, who will present a clinical overview of hypophosphatasia to provide a foundation for our discussion today. Dr. White is a world-renowned researcher in HPP, publishing scores of research papers, and he has the unique experience of having seen hundreds of HPP patients over the course of his career. Dr. White?
Thank you for asking me to tell you about hypophosphatasia. Again, this is hypophosphatasia, not hypophosphatemia, low phosphate levels, but hypophosphatasia is referring to low alkaline phosphatase activity. For us, we have 4 isoenzymes of alkaline phosphatase. 3 of them are expressed specifically in placenta, intestine, or in germ cells, and therefore called tissue-specific alkaline phosphatase, whereas the subject for now is ubiquitous. This is the alkaline phosphatase in bone and liver, and therefore referred to as tissue non-specific alkaline phosphatase, hereafter abbreviated TNS-ALP. TNS-ALP is a homodimeric enzyme. It's a zinc metalloenzyme using magnesium as a cofactor, and inorganic phosphate is a competitive inhibitor. You can see here that in addition to the catalytic sites, there's also some structural domains that are important to put the homodimer together to be active. Bone and liver alkaline phosphatase, familiar to clinicians, are really proteoforms of TNS-ALP, and they differ by post-translational modifications. Hypophosphatasia is an inborn error of metabolism. There are about 400 literature cases described in the literature, so we know the clinical, the radiographic, the biochemical features of this disorder fairly well now. First described in 1948. It's a disorder that affects all races. We don't know why, but it seems to be rare with Black ancestry. And the incidence for the severe forms, and I'll show you this in a few seconds, is about 1 per 100,000 births. The etiology of hypophosphatasia is exclusively loss of function mutations in the gene ALPL, with about 450 different mutations now identified worldwide. And interestingly, about 80% of these pathologic variants are missense changes. Hypophosphatasia is a heritable metabolic bone disease characterized by defective skeletal mineralization. So during growth in infants and children, a defective mineralization will result in rickets, and in adult soft bones or osteomalacia. Its biochemical hallmark is low serum alkaline phosphatase activity, or hypophosphatasemia, and it's an inborn error of metabolism where, if I could say, in the pre-DNA era, autopsy studies showed a global deficiency of TNS-ALP activity, but the other alkaline phosphatase isoenzymes were intact. Its inheritance can be, for the severe forms, autosomal recessive, but for the mild forms can be either autosomal recessive or autosomal dominant, and I'll show you some of this. Tissue non-specific alkaline phosphatase is a cell surface enzyme. It has 3 natural substrates. One is phosphoethanolamine, identified in the 1950s during the era of paper chromatography. In the 1980s, we found that pyridoxal 5' phosphate, the principal circulating form of vitamin B6, is elevated in plasma. And during the 1960s, inorganic pyrophosphate was identified to be elevated in blood and urine of these patients. If you remember how we grow our long bones by endochondral bone formation, and you blow up, so to speak, the physis here, the growth plate, you see at the top R for resting chondrocytes that then proliferate, Then they hypertrophy, and then the calcified cartilage has vascular invagination and then would eventually be converted from cartilage to trabecular bone. But if one uses electron microscopy to look at the hypertrophic zone in the growth plate, one sees these structures, so-called matrix vesicles, that are blebs of the osteoblast membrane, and they have a great deal of alkaline phosphatase on their surface. So calcium and phosphate can enter the matrix vesicles and form a hydroxyapatite crystal that you see at the bottom of the structure, but then that crystal grows and ruptures. And in hypophosphatasia, the accumulation of extracellular inorganic pyrophosphate, the inhibitor of mineralization, prevents those crystals from growing more and being deposited into the skeletal matrix. Therefore, skeletal mineralization is impaired. And again, in a growing child, this causes rickets, and in an adult, osteomalacia. One needs to get rid of the pyrophosphate accumulation to allow calcium and phosphate to enter the skeleton. So in hypophosphatasia, circulating calcium, phosphate, and vitamin D levels are not low. It's a very unusual sort of biochemical profile for a rickets or an osteomalacia. And indeed, the block of mineralization could be so severe that there's hypercalcemia when the disease is severe, and hyperphosphatemia with suppressed PTH levels, etc. Not all things that result in hypophosphatasemia are hypophosphatasia. Here's a differential diagnosis for what can cause low serum alkaline phosphatase activity. And there are some other bone diseases here, such as cleidocranial dysplasia, suppression of bone remodeling in Cushing's disease, some forms of multiple myeloma can all lower serum alkaline phosphatase levels. So what are the laboratory findings in hypophosphatasia? Importantly, in picking up these patients and following them, one needs to realize that serum alkaline phosphatase in the circulation is highest at birth, has another increase during adolescence, but then the levels, the normal range drops down during the adult years. So laboratories need to be giving you the reference ranges to help you make the diagnosis. But what about its nosology? This is possibly the most broad-ranging skeletal disorder in terms of severity. And the nosology that's developed over the years has talked about various forms of nosology according to the age when the diagnosis is made. And that reflects the severity of the skeletal disease. So the range at the very bottom goes from the most mild so-called odontohypophosphatasia, where there's dental abnormalities but no skeletal pathology, up to perinatal hypophosphatasia, which is, as I'll show you, obvious at birth and the most severe form. Perinatal hypophosphatasia looks like this. If you look at the radiograph, there's really almost no skeletal mineralization there. And you can see the accordion-like changes in the arm of this stillborn where there's not enough bone to really stretch out the skin. In perinatal hypophosphatasia, there's very often stillbirth, deformed limbs, and with the terrible hypomineralization of the thorax, respiratory compromise, and with that periodic apnea, bradycardia, and the severe skeletal disease obvious at birth. Infantile hypophosphatasia looks like this. This little one on the left is hypotonic, but looks okay at 1 month of age, but by 5 months of age has developed a bulging anterior fontanelle proptosis and a rachitic rosary. This is infantile hypophosphatasia with severe skeletal disease, wide fontanelles apparent on X-ray, hypercalcemia causing hypotonia, nephrocalcinosis. The skull doesn't grow, so you have a functional craniosynostosis and understandably failure to thrive, predisposition to pneumonia. And there's also, interestingly, vitamin B6 dependent seizures. But this is not present or apparent at birth. It becomes apparent before age 6 months. Infantile hypophosphatasia, if untreated, is lethal in about 50% of patients within the first year of life. Some may improve, but often there's sequelae of severe rickets if they survive. Childhood hypophosphatasia looks like this. Two brothers, the one on the right has some knock-knee deformity, but characteristically, they've lost their first inferior or mandibular incisors, then maxillary incisors, and the teeth slide out painlessly, bloodlessly, with their root intact, because the cementum that should hold them in place hasn't mineralized, and they lose their teeth prematurely in this way. They could have short stature with their rickets, delayed walking, rachitic deformity, craniosynostosis that's bony and can cause raised intracranial pressure, and with a weakness, often a waddling gait. But childhood hypophosphatasia presents and is diagnosed after 6 months of age. Then there's adult hypophosphatasia affecting these three edentulous sisters. In middle age, they develop stress fractures, metatarsal stress fractures. First they healed, and slowly then not at all, and then started to complain of thigh pain. And if you radiograph the proximal femurs, they had these cracks in their bones that hadn't healed, therefore weren't stress fractures, over a period of at least a decade. These are pseudofractures, and they're a radiographic hallmark of an osteomalacia. Adult hypophosphatasia can therefore be quite debilitating. This woman thought to have osteoporosis for many years before the diagnosis was recognized. And interestingly, there she is on the right, but she's a compound heterozygote for exactly the same mutations in ALPL shared by this brother and sister who have some rachitic disease during childhood. So some of the adults with hypophosphatasia have some evidence of the disease beginning in childhood. There might be a honeymoon sort of period during young adult life, but then by middle age it returns. Others present for the first time during middle age. Most mild is odontohypophosphatasia. This could be childhood or adult. There's premature loss of especially deciduous teeth, as I showed you in the children. The adults would manifest dental abnormalities, but there's no radiographic or even biopsy evidence of skeletal abnormalities. It's purely a dental problem. This fellow lost his lowers and then uppers before his 5th birthday, but again, no skeletal disease, and he could run like the wind, and if you ask him, hop like a frog, so he's strong. And then just to show you the extreme of mild hypophosphatasia, we would describe this robust little girl as having one tooth odontohypophosphatasia. At the bottom right, you see that one tooth was lost with its root intact, but then the next one lost was properly with the root resorbed by the osteoclasts. There's certainly more than the mutations underlying the disease that condition severity. These two little ones, sisters, have the same compound heterozygous mutations, but the one on the right has overt hypophosphatasia, yet the younger one is robust at the age where her adult or older sister was manifesting plenty of complications. So there's more to it than the molecular defects. Other genes that are conditioning pyrophosphate genesis, epigenetic factors, and even nutrition may be modifying factors for hypophosphatasia. So how does it get treated? Over the years, we tried infusing Paget plasma, Paget bone disease plasma, rich in alkaline phosphatase, marrow cell transplantation, and for adults using teriparatide off-label, Forteo, PTH, to drive what we hope would be an accompanying normal alkaline phosphatase allele. but without much benefit to patients. In 2005, I heard about from Inovia Pharma in Montreal, Canada, that they thought they could target tissue nonspecific alkaline phosphatase to bone. This became approved by you all in 2015 as asfatase alpha, trade name Strensiq. And it is a recombinant enzyme where the two catalytic domains of tissue nonspecific alkaline phosphatase hook up to a IgG1 Fc fragment to prolong circulating half-life. And then cleverly, a decaaspartate motif is put onto it so that it goes negatively charged, seeking hydroxyapatite crystals, and therefore is hydroxyapatite targeted, bone targeted, as a way of getting the enzyme to where it's necessary to hydrolyze the inorganic pyrophosphate inhibitor. In 2012, in the New England Journal of Medicine, we reported enzyme replacement therapy using this for life-threatening hypophosphatasia in severely affected babies and children. The first to receive this was this little one who was in need nearly of intubation. But then at 2 years of age and 1 year of treatment, able to do that. And after 2 years of treatment at age 3, able to do that. We then turned to the childhood form, severe childhood form, where there was skeletal disease and debility. This fellow walking at baseline 350 meters in a 6-minute walk test, wobbly walk. But at week 24 of therapy, he's able to go much further with a much more normal appearing gait. This young girl at baseline before therapy could hop only 14 inches, part of her weakness. But at 24 weeks of therapy, able to do that. And then finally, I show you this fellow who was able to walk for the first time at 3 years of age, but truly an exception in terms of the wonderful response that he had to this therapy. He becomes best on his baseball team at 8.5 years of age after 2.5 years of therapy. So there's an overview of hypophosphatasia. I thank you for your attention. Now I turn it back to the organizers.
Thank you so much, Dr. White. Well, it appears we've cleared up our technical difficulties, and so we're going to welcome back Dr. Beeston from the FDA. We're going to let you continue with your presentation.
Thank you, and sorry for the interruption. So briefly, we'll start with benefits and risks. Again, FDA considers balancing benefit and risks at all stages of development. So we will use gene therapy in clinical trial participation as an example, remembering that volunteering to participate or not is really a big decision. We encourage you to ask questions and discuss concerns, learn and understand to make the best decision for you and your loved one. Participating in a gene therapy for clinical trials for rare disease is a contribution to the knowledge base about the use of the investigational gene therapy product to treat your rare disease, and a gift of your time and more. But we need to understand that gene therapy, while promising treatments for patients and diseases or conditions that are a result of genetic mutations, have significant risks. Nonetheless, we all understand that for some patients, the risk of not having treatment is also significant. Therefore, the FDA works with the sponsors of the studies to ensure that the informed consent documents clearly present what is known about the potential benefits and risks at the time. These documents are updated for as more information is gathered. It is important to understand, again, that participation is your decision. In patient-focused drug development, or PFDD, it's a systematic approach to help ensure that patients' experiences, perspectives, needs, and priorities are captured and meaningfully incorporated into drug development and evaluations. Patients with the disease have the experience with clinical aspects of the disease, benefits, and burdens of currently available diagnostics and treatments. A patient-focused drug development meeting like today's is one way that FDA gains insight into how patients and their caregivers understand the potential benefits and risks and how they determine the balance. Patients are experts on what it's like to live with their conditions. They can articulate specific impacts of symptoms, loss of functions in concrete terms. Their chief complaints may not be factored in explicitly into drug development plans, for example, as endpoints and measures of the drug benefit in clinical trials, but it is important that we understand their point of view. Patients can identify and articulate what is important to them regarding treatment benefit, and they can provide insight into the experience with existing management and treatments for their conditions. Many patients want to be as active as possible in the work to develop and evaluate new treatments and aren't expecting the FDA to address all gaps in current treatment or current approaches to the drug development, but do want the FDA to help identify the most effective pathway for them to play major contributing roles in this process. Patient input from meetings can support the FDA staff in conducting benefit risk assessments for products under review by informing the therapeutic context and advising drug sponsors on their development programs. It might also support drug development more broadly by identifying areas of unmet need in the patient population, identify or develop tools that assess benefit of potential therapies, and raise awareness and channel engagement within the patient community. This slide provides examples of other opportunities for the FDA to learn from patient groups and other stakeholders. We invite you to contact us through the CBER Patient Engagement Program. And I've provided these links to help you learn where you can learn more information. This includes the clinicaltrials.gov link that I talked to you about earlier, as many as other groups that are interested in supporting development for rare diseases and patient-focused interactions. Thank you again for inviting me to participate in your meeting. We look forward to incorporating what we learned in learned today into the agency's thinking and understanding of how patients view benefits and risks of therapies for hypophosphatasia. Thank you again to Deborah and James for the introduction, and I will turn it back to them.
Thank you so much, Dr. Beeston, and thanks for hanging in there with us through the technical difficulties. We really appreciate it. I'd now like to welcome our moderator for today's meeting, James Valentine, who's been working with us over the past year to plan this meeting. James has worked over the last 14 years as a champion for the patient voice. He previously worked at the FDA, where he was a patient liaison, helping to incorporate the patient voice into medical product review. There, he helped to develop and launch the patient-focused drug development initiative. In private practice, James has worked with many patient organizations to ensure their community's voices are heard by decision makers. Relevant to today's meeting, James has been involved in helping and plan more than three quarters of the 65 externally led PFDD meetings. So we're in great hands with James. Wow. Thank you so much for joining us. And thank you for all of your work, working with Larry and your team to help us get ready for today.
Absolutely, Deborah, and thank you for that introduction. It's such a pleasure to be with this hypophosphatasia community today, and I'm really looking forward to engaging and hearing from so many of you. So, now that we've heard a clinical overview from a disease expert, we turn to the core of today's meeting, which is to hear from you, people living with hypophosphatasia and their parents, spouses, and other direct caregivers. Patient-focused drug development is a more systematic way of gathering patient perspectives on their condition and on available treatments. And as we just heard from FDA's Dr. Beeston, your input can help inform the agency's understanding of HPP to inform drug development and review. While FDA has held many of its own patient-focused drug development meetings, today marks the 70th externally led PFDD. With over 10,000 known rare conditions, this is truly a unique and important opportunity for this community. Today's meeting is interactive, so let me tell you a bit about what we'll be asking of you and how you'll be able to participate in this meeting, as well as how it's organized. In our first session, which will be this morning, we'll be exploring the patient and caregiver experience with living with HPP and its impacts on you and your loved ones' daily lives. In our second session in the afternoon, we'll bring everyone back together to explore the various approaches to treatment, including participating in clinical trials, and we'll also be asking for your preferences for future treatments. So what will these two discussions look like? Well, we'll be using a few different methods for hearing from you throughout the program today. First, for each of our sessions, we'll kick off by hearing from a panel of patients and caregivers of individuals living with HPP. These panels will help set a good foundation for our discussion, and the individuals on the panels were selected to reflect a range of different experiences of living with and being treated for HPP, although we understand that no panels could represent the full range of experiences of this condition, which is why the facilitated audience discussion that will follow will be so important. So when we get to that audience discussion, we'll open it up to all of our patients and caregivers who are tuned in today, again, building on what we just heard from the panels. I'll be posing questions and then inviting you to state your name and provide a comment on those topics. You'll be able to do this in a couple of different ways. I'll be inviting you to dial in by phone, but you can also submit written comments. We'll also be welcoming a panel of patients and caregivers who will be joining us by Zoom, who will also be contributing throughout those discussions. And finally, we'll be broadening our understanding of your experiences through the use of polling questions. Patients and caregivers only can use a browser on their phone or on their computer to respond to polling questions. And actually, we can go ahead now and get you in this system, as we'll be going to some polling questions in just a few minutes. If at this time you can go ahead and pull out a phone, open up a browser, open up a tab in your web browser, go to www.polle, as in Edward, V as in Victor.com, pollev.com/HPP-PFDD. Again, feel free to go there now, www.pollev.com/HPP-PFDD. Once you get to this webpage, you can stay on this throughout the entire day. And as we get to new questions, those will automatically appear there, and we'll be getting to some polling very soon. These polling questions will broaden our discussion to everyone in the live audience and aid in our discussion, as it will have you all be thinking about some of the topics we want you to reflect on when you do call in or write in. We'll also have the opportunity for you to provide written comments for 30 days after this meeting. So whether it's after the meeting you realize that there was something that maybe came to mind that you didn't have a chance to share, you can still submit that. Perhaps you shared some throughout the day, but there's more you want to contribute. Or maybe you're watching this video on demand after the live meeting. You can submit comments too, again, for 30 days after the live meeting date. All of today's input and all of that written input will be summarized in what's called a Voice of the Patient report, which will be provided to the FDA as well as made available publicly for researchers and drug developers alike. So one more thing before we get into it, I want to go over a few ground rules. We encourage people living with HPP and their parents, spouses, and other direct caregivers to contribute to the dialogue. Again, you can do that through polling, calling in by phone, and submitting written comments. The discussion today is limited to patients, family members, and other direct caregivers of people with HPP. Meanwhile, our other stakeholders, from the FDA, from drug developers, as well as clinicians, are here to listen and learn. I also want to mention that views expressed today are going to be inherently personal, and the discussion may get emotional at times, which means respect for one another is paramount. And to that end, we ask that you try to be as focused and concise as possible when providing your comments, so that way we can hear from as many voices as possible. So without further ado, let's get into our first set of polling questions. So again, go to that webpage, www.pollev.com pollev.com/HPP-PFDD. Again, pollev.com/HPP-PFDD. This is for all of our patients and direct caregivers. Once you get to this webpage, again, you can stay on it throughout the entire day today. As we go to new questions, you'll be able to answer those as they'll appear automatically. So this morning, we were going to ask you a few questions to get a sense of who we have represented from the HPP community in our audience today. Our first question is, we'd like to know, are you either A, living with hypophosphatasia, or B, a caregiver of someone with hypophosphatasia? And we'll give you a few moments here to get in your responses to this question. We know this, since this is the first question, it may take you a few moments to get into that polling system. We want to try to capture as many people as possible in these polling questions, so that way we can track your responses from throughout today's meeting. So we'll give you a few more moments here to get in your responses. As it stands, it looks like we have just over 60% of our audience has individuals who are living with hypophosphatasia. And then we have a little over a third of our audience are those that are caregivers of someone living with hypophosphatasia. Again, today we want to hear from both patients and caregivers alike. If we can move to our second polling question. Here we would like to know where you currently reside. The options are A, the U.S. Pacific time zone, B, U.S. Mountain time zone, C, U.S. Central time zone, D, U.S. Eastern time zone, E, U.S. Alaska time zone, F, U.S. Hawaii time zone, G, Europe, H, Middle East, I, Asia, J, Canada, K, Mexico, or L, some other country or region not reflected in the other response options where you currently reside. Again, this is for our patients and our direct caregivers. So as it stands, it looks like we have a little over half of our audience living in the U.S. in the Eastern time zone. However, we do have good representation across the other U.S. time zones, Pacific, Mountain, and Central times. I'd also like to recognize those that are tuning in from Europe. While this meeting is being conducted out of the U.S., we very much welcome you into the program and would like to encourage you to also participate in the dialogue. It is not limited to just those who are living in the U.S., as well as notice that there is someone that selected other. So wherever in the world you may live, we'd love to hear from you as well. If we can go to our third polling question. So we'd like to know, are you or your loved one with hypophosphatasia A, female, B, male, C, non-binary, D, other, or E, prefer not to identify? So here we'd like to know, are you, if you're the person living with HPP, or if you're a caregiver for your loved one with HPP? Are they A, female, B, male, C, non-binary, D, other, or E, prefer not to identify? So as it stands, it looks like we have just about 3/4 of the audience of people living with hypophosphatasia female. About 1/5 are male, and we have just under 5% that are non-binary. We go to our next polling question. Here we'd like to know, how old are you or your loved one with hypophosphatasia? So again, the age of the person living with HPP. The options are A, 0 to 5 years of age, B, 6 to 10 years of age, C, 11 to 18 years of age, D, 19 to 30 years of age, E, 31 to 50 years of age, F, 51 to 70 years of age, G, 71 years of age or older. And we do recognize that we may have some caregivers today that are representing people with HPP who are no longer with us. If that is you, you can also select here the age range of the person with HPP at the time that they passed away. And we do welcome you to answer the polling questions throughout the rest of course today on behalf of your loved one who has passed away. So as it stands, it looks like we have over half who are currently between 51 and 70 years of age living with HPP, just over a fifth in the 31 to 50 year age range. But we do have representation in each of those younger age ranges, except for the 0 to 5 years of age. And we also do have some representation in those that are 71 years of age or older. All right, we have one more polling question here. Is this first batch of questions to understand our audience. We go to our fifth polling question. Here we want to know, what type of hypophosphatasia do you or your loved one have? So the options are A, perinatal or prenatal benign, B, perinatal lethal, C, infantile, D, childhood, E, adult, F, odontohypophosphatasia, G, pseudohypophosphatasia, or H, if you're unsure which type of hypophosphatasia that you or your loved one has. So while results are trickling in, it looks like we have just over half of our audience representing those with childhood hypophosphatasia, about a quarter representing infantile hypophosphatasia, over 10% representing adult, as well as over 10% who are unsure in our audience today. So with that, I'd like to thank you for participating in this first set of polling questions. I promise as the day goes on, the polling questions will be a little bit more difficult to answer, but it is just so helpful to get a sense of who we have in our audience today. So at this point, we're going to move into our first topic discussion to understand what it is to live with hypophosphatasia, understanding the symptoms and daily impacts of the condition. So I'd like to call up our first set of discussion questions. These are some things we'd like you to reflect on and consider calling in and writing in to talk about. We'd like to explore as part of this morning discussion to have you think about of all the different symptoms and health effects of hypophosphatasia, which maybe 1 to 3 of those symptoms have had the most significant impact on you or your loved one's life. We also recognize that these symptoms and health effects may vary from day to day, so we'd like you to think about how does hypophosphatasia differ maybe on a best day versus a worse day. We also know that the symptoms and the condition changes over time, whether that's week to week, month to month, or over the course of years. So we'd like to understand how symptoms have changed over time, as well as the ability to cope with those symptoms. We not only want to hear about those direct symptoms and health effects, but we'd like to understand how that impacts daily life. So we'd like you to think about whether there's specific activities that are important to you or your loved one that you cannot do at all or as fully as you would like because of hypophosphatasia. And finally, recognizing that while there's so much that you and your loved ones have already experienced as a result of HPP, you may also be thinking about what life with HPP looks like in the future. So we want to know, what do you fear the most as you or your loved one gets older living with HPP, or perhaps what worries you the most about their condition in the future? So to help us get started in this discussion on some of these exact questions, I'd like to invite our first panel, some of your peers of people living with HPP and caregivers. We have Lakin, Becky, Ellen, Sherry, Amy, and Suzanne. Lakin, take it away.
My name is Lakin, and I'm the mother and caregiver of Rowan and Rise, ages 2 years old and 9 months old, who are both diagnosed with hypophosphatasia, or HPP. Both Rowan and Rise were diagnosed prenatally. I was referred to maternal fetal medicine, a high-risk specialist, for both of the boys' pregnancies. Both boys were diagnosed with HPP via amniocentesis confirmation. Rowan at 24 weeks gestation and Rise at 23 weeks gestation. Rise's physical presentation has been less severe than Rowan's across the lifespan. Rise is primarily affected in his lower arms and forearms, showing mild shortening and curvature, whereas Rowan is affected in all of his long bones with moderate shortening and curvature. Despite medication therapy working to promote bone growth and strengthening, both boys remain in the less than 1 and less than 15th percentile for height. Shortening and curvature of the long bones was the first symptom of HPP that was detected. Other comorbidities of HPP that both boys have experienced include vitamin D deficiency and hypercalcemia. Both boys have experienced growth, mineralization, and gradual straightening of their long bones as evidenced by X-ray. This is entirely because of their current medication regimen and therapy. Rowan received occupational therapy up until he turned 1 year old. Through OT, we discovered mild deficit in the flexion of his left foot and ankle. Through continual exercises and stretching, along with weight-bearing activities and the use of KT tape, this has improved. The most prominent symptoms or effects of HPP on not only the boys, but the entire family unit has been fear and anxiety. Fear related to the unknowns of the diagnosis have been instilled in our family since before we received their diagnosis. I can recall the countless nights spent crying, yearning to find more information on this diagnosis, mourning what felt like the loss of a normal pregnancy and life for my children. Every prenatal appointment, NICU round, and specialist appointment concluded with a reminder of what complications and comorbidities to monitor for, always reinforcing the idea that our boy's now stable condition wasn't truly stable and always risked decompensation. This fear was instilled so deep that despite knowing how stable Rise's condition was upon discharge, as told by the doctors from the hospital, that I called 911 his first night home because he suddenly wasn't acting his normal self, and I mistook it for respiratory distress. I have never feared for my child's life like I did that night. I fear how my boys, affected with a rare metabolic disease with a known height deficit, will be treated by a society that doesn't support being a short boy. Will they harbor jealousies against each other as their presentation is so different despite being affected by the same disease? Will they ever find a supportive partner who they can have children with despite knowingly passing a genetically inherited condition? Both boys risk being affected by the constraints of society's social norms and expectations. At present day, we can see anxiety in the boys created by medication administration, fear related to the pain of administration. Hypophosphatasia continues to affect both boys physically at this current time, with the potential to affect them socially as they grow older. Due to the nature of the diagnosis and not knowing how well their bones may handle contact or impact sports, we try to promote more individual or non-contact leisure activities. This is to prevent any additional risk of fracture. Rowan and Rise are at an increased risk of being affected psychosocially. Their diagnosis sets them apart from the norms of other children their age. Regarding infant handling, both children were handled with more caution, specifically when being picked up and when having their diaper changed. What I fear most as my children get older is the potential for them to decompensate. This can include losing their level of mobility to some degree or acquiring chronic bone pain. I also fear the effects of the diagnosis on their social development and mental and emotional health. What frustrates me most about the diagnosis of hypophosphatasia is the constant state of unknowns that the diagnosis carries, especially because every individual is affected differently in regard to their level of severity, even if within the same family composition. Both boys were discharged from the hospital with many specialist follow-ups. Every specialist educated us on the common comorbidities to watch for, reinforcing the fear that our children's now stable condition was not guaranteed. The fear that was instilled in us as parents created a lasting anxiety that ultimately resulted in feelings of extreme isolation. While medication therapy has significantly improved the health outcomes of both children, the course of the disease is still unknown. We will not know if the boys will be affected with fractures, gait impairment, or chronic pain as they grow older. Not knowing the capacity in which my children may suffer is the hardest part.
This story starts in a small village in China. A chubby-cheeked baby girl with curved and twisted arms and legs was found on an old man's doorstep. My name is Rebecca Raguso, and I am that baby girl's mother. My husband, oldest daughter, and I got to wrap our arms around Juliana when she was 20 months old. She was full of light, mischief, determination, and was riddled with pain. She could not stand, and her perfect little feet were twisted almost backwards. She was diagnosed with hypophosphatasia within a month of arriving in the United States. She didn't qualify for the Strensiq drug trial because we couldn't prove she was symptomatic before she was 6 months old. So we spent our days treating her migraines, her back and neck pain, her constant vomiting, and trying to keep up with her untamable spirit. In spite of her pain, and in spite of her inability to stand or walk, she climbed everything and developed her own sign language to communicate with us until she started using English words. We educated her preschool on the condition so they wouldn't send her home every time she threw up or be shocked when her teeth fell out, roots and all. They made sure all vegetables were cooked soft for her toothless self and learned how to work the 5-pound twister cables she wore when they changed her diapers. Juliana was 3.5 when she started Strensiq. She received 3 slow injections a week. Within a month, she was able to jump and run. Her muscles grew stronger, and she spent the entire summer working on riding a tricycle all the way around the sidewalk loop at preschool. When she finally completed the loop, her teacher cried when she told me about it. With treatment of Strensiq, her migraines went away. She stopped throwing up, and her pain levels decreased. When she entered elementary school, she was socially ready, but we knew she would struggle academically. We had a hunch that she had some learning disabilities, which we had heard anecdotally could be connected to HPP. She has speech delays, ADHD, dyslexia, dyscalculia, working memory issues, and expressive language disorder. She repeated kindergarten and receives help from the special education team at school. She works so hard to catch up in school. She's wicked smart, so determined, and loves homework. However, there are too many days when she comes home from school crying because she feels dumb. We work tirelessly to help her feel confident in her abilities and know beyond a shadow of a doubt that she is not dumb. She receives dexmethylphenidate for ADHD, and it works beautifully to help her focus in school and take her time on tests. She used to race through tests with very low scores, and now she takes about 3 times the length of her classmates, and her test scores have skyrocketed. She is now entering 4th grade. She has lots of friends who all know about her condition and slow themselves down to play with her at recess. She can't keep up with them, so they keep up with her instead. When she was recovering from a double tibial osteotomy in 2nd grade, there was a little boy who brought her a gift so that she could play in her wheelchair at recess with it. When she started walking with twin walking boots, there were a couple of kids who just sat on the swings with her or brought out sidewalk chalk to do with her. She sits out field day every year, but helps her teacher take pictures. In PE, she requires a lot of breaks, but her PE teacher gets it and finds other ways for her to participate, like scorekeeping or calling players out. Outside of school, she loves horses and takes lessons from an adaptive teacher. Juliana is a natural on a horse. She is very frustrated that she can't play soccer or lacrosse like her friends because one accidental kick to the leg would break her. She tried ballet but couldn't get her feet correct, but loves tap and Chinese dance. Juliana also suffers from medical PTSD. Sometimes it rears its ugly head after a painful injection or a doctor visit, and it's always present before and after a surgery. She has had 6 surgeries, and 2 of them were 2-night hospital stays with a lot of pain and vomiting. We can always see a PTSD rage coming when she starts quietly and systematically tearing her room apart. I have learned that the best thing to do is stay close, and when she is ready, just wrap her in my arms and let her cry it out. She has told me repeatedly, "Mom, I don't think I will reach my grown-uphood." That's my biggest fear too.
My name is Ellen, and my story is one of both caregiver and now patient. I was 4 years old when my sister was born with HPP. She had failure to thrive, and at 1 year old, her weight was the same as her birth weight. She did survive, and my caregiver journey had begun unbeknownst to me. HPP dictated our family life in every way. Her first fracture that I remember was at age 3. And while sitting on the back porch eating corn on the cob, she dropped hers and reached for it from the bottom step. She tumbled from that one stair and broke her leg. That meant hospitalization. She would be in traction for 3 months. After 3 months, her break was never healed. So then she came home in a body cast. This is a heavy cast around her trunk and down the broken leg to the toes. This meant bedpans, sponge baths, and everything brought to her. Weeks or months later, when she finally got the cast off, her muscles were atrophied, and then physical therapy started. When she finally got to the point of walking, it would take almost a year. Not long after, she would break again, and it would all start over and over again and again. They had re-diagnosed her with osteogenesis imperfecta and started rotting all of her long bones. That gave her much more stability. We all benefited from that because casts were not needed with those surgeries. As an adult, I have always lived close and able to help when needed. I would leave school and later work and go to the hospital to do my share with the evening shift to help feed and entertain during her numerous hospital stays. When I married, my husband was aware that she would live with us someday when necessary. Fast forward to 4 years ago when her health started to fail. Her lung function is affected because of weak rib bones, and she had to go on oxygen. HPP affects a lot more than just bones, and she really was not doing well. We sold our house and built one that was handicap accessible, that would fit my 93-year-old parents, my sister, my husband, and myself. My sister has gone on treatment, and it has turned her life around. She is off oxygen, and her health is much better. Now, if she cracks a bone, it heals in a normal healing time and usually does not need to be hospitalized. It has taken her from wheelchair bound to part-time crutches. It's not a cure and it doesn't fix everything, but it certainly made everyday living much better. Mom, Dad, and I were told we were carriers of HPP and would never have any symptoms. We now know that is a false statement, and we are all in different phases of onset of HPP. My parents have had major joint problems due to hypophosphatasia. Dad had to have both knees and hips replaced. Mom's spinal scoliosis and collapse caused her to need walkers long before her aging should have needed it. She also needed both shoulders replaced due to the unexplained bone deterioration. Since there's a wide range of symptoms presenting with multiple intensities within family members with the same HPP genes, it's difficult to define HPP. This leads to misdiagnosis and diagnosis with unexplained findings. I am dealing with pain in the neck, hips, ankles, back, and feet. I'm a medical assistant and on my feet all day, and some days the foot pain is so bad I can hardly walk the halls to do my job. It can stay for days to weeks, and then again it can last for only hours. My neck pain is worsening with computer work and then triggers migraines. I need to continue working. I'm not able to retire early, so I just push through. The bone, muscle, calcium crystals that cause the pain is disabling at times. Since it can be gone in hours to days, it's hard to get doctors and employers to believe you aren't making it up. I get home and make dinner and help clean up. I'm physically and mentally exhausted when I finally land on the couch. I can barely get up and keep moving when it's time to get everybody ready for bed. With every pain comes the panic of thinking, is this the day I become disabled? And then what? Thank you.
Hi, my name is Sherry and I live in Cincinnati, Ohio with my husband Mike and my daughter Maya. I also have a daughter, Sarita, who lives in Cleveland. In 2019, Maya and I were diagnosed with hypophosphatasia. Maya was 15 and I was 55. Maya and I share the same genetic mutation, but our symptoms vary greatly. Sarita was diagnosed 1 year later without genetic testing due to low ALP, high B6. When Maya was 11, her health seemed to decline rapidly. She went from constantly running around the backyard to sleeping all the time and complaining about pain. She fell asleep during class and she cried every day that she hurt. This started our 4-year journey to a diagnosis of HPP. Within 4 years, we saw over 11 specialists, received 21 diagnoses, and we were prescribed 32 medications, none of which took away her pain and fatigue. By the end of 6th grade, She was a shell of the child she used to be. My heart was broken. She didn't want to live the life she had. She rarely left her room, and when she did, my husband had to carry her due to the pain she had in her legs. Although all three of us have HPP, our symptoms vary greatly. Sarita is 23 and has been able to attend college, get her degree, and start a job. I have worked professionally and raised a family. We both struggle daily with our health, from chronic conditions to autoimmune diseases. And now you'll hear from my daughter, Maya.
Hi, my name is Maya. I am 18 years old and my life has been terribly altered because of hypophosphatasia. In 2019, I was diagnosed with HPP. For many years, I had very bad pain and fatigue. I suffered from many chronic illnesses, including autoimmune disease. I played sports as a kid. I was good at gymnastics, tumbling, and cheerleading. I enjoyed diving, volleyball, soccer, and lacrosse. I did get injured playing sports. I just didn't know I had HPP. Summer 5th grade changed for me. I went to summer camp for the first time for 2 weeks. Afterwards, I felt sick and spent a lot of that vacation in bed. The rest of that summer, I was very tired and sick. I was excited to start the first day of 6th grade, but my body was hurting so much and my head felt like it was exploding. I finished the day in tears. I went straight to my mom's car and said, "Take me to the hospital because something is very wrong with my body." They gave me a migraine cocktail and ran some tests. They assured me the tests were fine and that I was fine. I struggled every day to either go to school or to stay at school. I was falling asleep in class. The fatigue I felt was so overwhelming. The migraines were awful and I couldn't even keep my eyes open. The lights hurt my head so much. It was hard because I know my teachers didn't understand and I know they didn't believe me. I tried to tell them how much my body hurt and how much my stomach hurt, but it looked normal to them. I started having seizures that were staring spells. I was missing school trying to figure out what was wrong. My classmates told me I was faking, and this turned into bullying. I was struggling with my mental health. Eventually, I couldn't attend school. I was too sick. In the years to follow, we tried many different methods for education, but it was very different. I couldn't keep up. I couldn't concentrate. I could only think about the pain I was in. I had so many doctor's appointments, and nobody could tell me what was wrong. Some doctors even told me it was in my head. I was taking so many pills, but none of them were making me feel better. Some of them actually made me feel worse. I just felt like nobody understood what I was feeling. My mental health continued to get worse, and I felt totally isolated. My new school was great and put many precautions in place to help me feel safe. But it was hard for me to be in that kind of environment because of my anxiety. I still missed a lot of school for many reasons, but the school still supported me. I'm mostly homebound. I'm still trying to get out more, but it's challenging to find friends and not feel so anxious. I've been totally isolated from having HPP. The friendships have been impossible to have and maintain. I've had countless bone fractures and injuries. I have a fear that I won't be independent when I want to be independent. I'm 18 and I worry about college, working, getting married, and having kids. I just want to feel better. I just want to laugh again like I did when I was a little girl.
My name is Suzanne. I have always dreamed of flying in a body with wings, agile, graceful, and without pain. Hello, I'm Amy, Suzanne's identical twin. As a child, I saw a man with a prosthetic leg, and ever since I've dreamed of having them. How great it seemed it would be to have legs that don't hurt. After a lifetime of symptoms and searching, a genetic test showed we had an ALPL gene mutation known for causing HPP. But even still, doctors didn't believe us. One doctor told Amy she couldn't have HPP because she didn't die as an infant. Another said she couldn't have HPP because she could get up out of a chair. Another said our gene mutation did not cause disease. As an infant, I did spend a month in the hospital. The doctors wouldn't let my mother visit because I cried too much. They told her to go home and focus on the baby that was going to live. Years later, my own daughter cried for her first 18 months. We went to countless doctors. Year after year, we were told, she just has a low pain tolerance. She's faking. She just wants attention. Our mother had been shamed by so many doctors that when we were kids, she told us not to tell our doctors about our unusual symptoms. Our grandmother died, never knowing why she couldn't walk well. We thought she just didn't try hard enough. We didn't understand that all our symptoms were connected. We had lazy eyes, which delayed our reading. Amy had 13 years of speech therapy. We had terrible growing pains, which we never outgrew. There were times when all of my teeth were loose. We had dysautonomia, but we wouldn't learn what that was until we were 52 years old. Some of the symptoms or comorbidities of HPP are strange and underdiagnosed diseases in themselves. The overwhelming variety of symptoms and lack of understanding can make you feel crazy. Depression and anxiety added layers to an already difficult diagnosis journey. We've had surgery to correct our eye muscles, knees, wrists, and torn rotator cuffs. We've had bursitis, terrible tendonitis in our arms and ankles, frozen shoulders, plantar fasciitis. We have calcium deposits that shred tendons and destroy cartilage. We've had broken wrists, ribs, fingers, toes, and microfractures in our feet. Our spines have scoliosis with bulging discs, herniations, and severe degeneration. We have osteoporosis, early cataracts, lifelong tendinitis, insomnia, problems with balance and regulating temperature, sleep apnea, severe fatigue, muscle pain and weakness, and Chiari malformation. Amy suffered from lifelong constipation. Her migraines have been persistent and debilitating. The bones in our forearms are fused, limiting mobility. The worst of all the kinds of pains we experience is a kind of neuropathy that makes it feel like our legs are on fire. The thing about having undiagnosed HPP is you end up getting all kinds of treatments, surgeries even, that don't help. Until you address the underlying cause, low alkaline phosphatase, you're just chasing symptoms that lead you in 1,000 different directions. My body was in so much pain, even while sleeping, that I'd wake up crying. I was disappointed to wake up every morning, not knowing how I could get through another day. As kids, we were slow and clumsy. We couldn't move fast. The other kids didn't want us on their team. We thought we just needed to try harder, ashamed of anyone knowing how hard we were working to keep up. My mind was slow too, in a fog. I couldn't hold on to thoughts or find words. I couldn't remember. Homework took forever. At age 50, a city bus grazed my hip while I crossed the street. I had never been so scared in my life, but I was not able to move any faster. That's when I finally realized that I had been trying as hard as I could all along. Fatigue, anxiety, pain, and brain fog were so bad that I had to quit my job. Amy pushed forward for a diagnosis. Finally, at age 53, our diagnosis was confirmed. When I first learned that we had HPP, I wondered if the leading cause of death among HPP patients was suicide. The pain and lack of hope were unbearable. But now, because of all we've gone through, we know that our children and grandchildren will be spared living a life undiagnosed. We are hopeful that they will have better treatment options. With a disease so varied in symptoms, even among identical twins, to have multiple treatment options will be huge in helping us to live our lives to the fullest.
Wow, thank you, Amy and Suzanne, for sharing your journeys with HPP, and really to all of our panelists. That was incredible. And thank you for being so brave to share first with us this morning as we explore what it is to live with HPP. So now we're at the point in our program, it's our first opportunity to expand the discussion to all of you who are live, tuned in, people living with HPP and family members and caregivers, to hear from you about your experiences with the symptoms and health effects of this condition. To get us started in this discussion, we're going to kick it off with a couple of polling questions here. So if you were with us before, you can just go to that same website you had before. If you've just joined us, please open up a new tab on your browser, pull out your phone, go to that browser on your phone, and go to www.polev.com/HPP PFDD. Again, that's polev.com/HPP PFDD. So, as we're thinking about the experiences of those living with HPP, we'd like to know from you, which of the following hypophosphatasia-related health concerns have you or your loved one ever had? And please select all that apply. The options are A, walking and mobility issues, B, skeletal issues like fractures, slow healing, and joint deformities, C, pain, things like pain in the bone pain, muscle pain, or joint pain, D, brain fog and fatigue, E, seizures, N, F, neuropathy, G, kidney stones or other kidney issues, H, losing teeth early or other dental issues, I, sleep disturbance, J, Chiari malformation or craniosynostosis, K, depression, anxiety, or ADHD, L, headaches, or M, some other hypophosphatasia-related health concern that you or your loved one have ever had that's not otherwise reflected in these response options. I'd like to point out as we see these results coming in, this is our first question where individuals can select more than one option. So when you see the percentages showing up, that's not the percentage of people who have selected any one option. It's the percentage of the total responses that have come in. So the best way to look at these types of questions is look at those bars and think of them as kind of a relative ranking based off of the size of those bars relative to one another. So while some final responses are coming in, it's looking like some of the most common experiences of those with HPP in our audience today are pain, followed by brain fog and fatigue, walking and mobility issues, losing teeth early and other dental issues, skeletal issues, sleep disturbance, anxiety, depression, and ADHD, and headaches, followed closely behind by neuropathy. But really, every single thing on here is experienced by a number of people in our audience, including quite a few other things. We want to hear about these range of different symptoms, whether it's the most, like pain, which is at the kind of top of our list here, or something that's maybe not as frequently experienced in this community, like seizures. But whichever it is that that you've experienced, and whichever may be most bothersome to you, we'd want to hear about. And in fact, if we move to our next polling question, we're going to begin to have you think about which of those are most troublesome. So thinking about that same list of issues, please select the most troublesome hypophosphatasia-related health concerns that you or your loved one had ever had. Select the top three. So the options are again the same: A, walking and mobility issues, B, skeletal, C, pain, D, brain fog and fatigue, E, seizures, F, neuropathy, G, kidney stones or kidney issues, H, losing teeth early and dental issues, I, sleep disturbance, J, Chiari malformation or craniosynostosis, K, depression, anxiety, ADHD, L, headaches, or M, again, some other hypophosphatasia-related health concern that in this case represents one of those top three most troublesome. I'll give you a few moments to think about this, just seeing on the previous line how many things were so highly reported as being experienced in this community. It appearing many things being, each person experiencing many things just based off of how big those bars were across the board. It's interesting now that, have to narrow it down and pick just, 1, 2, or 3 things here.
Yeah, you heard Dr. White talk about how HPP is really a bone disease with the greatest spectrum of severity, and we're seeing it on that last polling question, and it's interesting to see some of the themes that go across many of the different patients and some of the things that are constant and common among them, like the pain, like the walking issues, like the brain fog fatigue. We see that come across quite a bit.
Yeah, we're seeing some of those rise towards the top here, some of the top 3 most troublesome hypophosphatasia-related health concerns. Looking like pain is by far the top one that's most commonly selected by our audience today. Second, after that being walking and mobility issues, perhaps a third tier being a combination of the skeletal pain as well as the mental health aspects of this. But really striking to me is that at least one, maybe more people selected each one of these as their top 3 most troublesome symptom. So not just something they've experienced, but one of those things that they consider the most troublesome for them. So again, as you are thinking about which of these you selected, I want you to think about why you selected it, and I want you to think about calling in and sharing, that why. I'm sure something came to mind to you that made you pick it over some of those other things that maybe you or your loved one are experiencing. So if you'd like to share on one of these different topics or maybe one of those other things that wasn't listed, we'd like to invite you to call in at this point. The phone number for calling in is 1-703-844-3231. Again, we'd love to hear from you on the program today at 1-703-844-3231. When you call in, you'll get connected with our phone operator, and we can get you into the queue so we can bring you into the conversation. I'd also like to let you know that if you'd like to submit written comments on any of these topics at any point today, you can do so using that written comment form that's under the live stream on the webpage you're following along on today. But while people are calling in and writing in, I'd like to welcome some of your peers who have joined us by Zoom here today. People living with HPP and caregivers who will also be sharing their experiences. And while we're on this first topic of really understanding those different symptoms and health effects and really which of those are most troublesome, I'd like to bring you in, some of you into the conversation to kick us off. And maybe, Lindsay, you can start. As you're looking at that wide range of different things, what did you pick as some of the most troublesome things? And importantly, why did you pick those?
Thanks, James. I'm Lindsay. I'm from Nebraska, and I'm a caregiver of a 13-year-old who has infantile HPP. So when she was younger, her main symptoms that were hard were seizures, oxygen dependency, and craniosynostosis. So she had surgery at 10 months, 2 and 5 for craniosynostosis. So we were dealing with a lot of issues with that. Now that she's 13, I would say pain would be her number one symptom. Her feet hurt probably all the time. And just knowing how to help her manage school and friends with the pain that she's dealing with is a big deal for us.
Yeah, thank you, Lindsay. And I'd like to maybe explore that a little bit, because pain could mean different things. It could come from different parts of the body. It might be felt a little differently. So, how is she experiencing pain? Is it, isolated to any areas? Can you maybe just describe it a little bit for us?
Sure. So when she wakes up in the morning, she's really stiff. She's doing physical therapy. So we have a number of exercises she can do so that she's able to walk in the morning. And then after any long period of standing, it's usually her feet and her ankles that hurt the most.
Sure. And do you find that the pain is greater, from one day to another? Is there any way to predict, from one day to the next, maybe in the morning? Well, you mentioned kind of a wake up routine, is she just, right from the get-go, maybe having a worse or better pain day, or is it really dependent on how the rest of her day goes?
It usually is dependent on how much physical activity she has during the day. We've found ways for her to sit more during school so that she's not on her feet quite as much. By the end of the day, we can do some massage or some things that'll sort of help her pain to wind down so that she can sleep. But it usually depends on how much physical activity she has that day.
Sure. And does it ever depend on physical activity in prior days, or is it all just, really from one day to the next?
That's a great question. I'm not sure that she can quite articulate that since she's 13 and she's usually thinking about, the next thing she wants to go do. But
Gotcha.
she will ask for, an ibuprofen or an Aleve if she knows there's something she needs to do that day, like PE or trick or treating, or she can usually predict when her pain is going to flare up.
Gotcha. Well, thank you so much, Lindsay. Aaron, I'd like to bring you into this conversation as well, thinking about maybe some of those symptoms and health effects that are are most troublesome, what came to mind for you?
Yeah, so I'm Aaron Blocker. I'm from Mississippi, and I live with hypophosphatasia, the childhood form of the disease. And for me, I mean, I selected the mobility, pain, and then some of those skeletal issues as well. For me, I actually had hip replacements when I was 20, and then I had hip replacements again when I was 24. So the pain and that I deal with, the skeletal pain, can be pretty extreme some days. That type of bone pain that is just so severe. And then the mobility aspect of that, just from having so many surgeries and hip replacements and how the disease has affected my muscles and tendons. Those are the two things that I deal with commonly on every single day. And the things that I have to, be very mindful of what I do, continue constantly. I feel like I'm in physical therapy, and just trying to keep up with the mobility that I have and strength and everything. But the pain and mobility is extremely bad, and it makes some days very hard.
Sure. So, Aaron, a couple of things that I want to follow up on. But first, you kind of talked about some extreme bone pain. I don't know. Is this something that you experience daily? Once a week, once a month? How often is it that extreme pain are you experiencing it?
It's often, I mean, it's usually every other day. There are weeks where it's every day. It does kind of vary depending on, what's going on and what I have done. But it is definitely more often than I would like. But it's definitely there multiple times a week.
Wow.
For sure. Yeah.
And is it usually the same areas, same bones that are causing the pain, or does it vary at all? What location is painful?
Yeah, I mean, it varies, but I would say the most common is in my knees and my elbows, those joints that I have. Right.
And then, Aaron, you also talked about some of the mobility challenges, and some of the impacts even on your muscles. There, I'd like to, maybe understand how you first, recognized yourself either in childhood or maybe even as you grew. Some in adolescence into adulthood, what were some of the things that you noticed earlier on that made you realize you were having some mobility issues? Kind of what stands out in your mind along those lines?
Yeah, I mean, so as a adolescent teenager, there were things that started popping up that kind of made me realize something was going on with my bones and my mobility. Obviously, that extreme bone pain was there. I was diagnosed a little later in life, so these were things that came up that we weren't necessarily sure what it was coming from. And it was probably around between ages 16 to 18 is when I really started realizing that my mobility was on a downturn. In 2 years, when I was 20, I had to have my hips replaced because my hip bones failed. So that obviously affects mobility at that point, but that started when I was 17 to 18. I started having those severe hip problems and that mobility. I was on crutches and a walker. I had all of these aids that I needed to kind of get around until I had more surgery. But it definitely was in my about 16 to 18 when that mobility stuff really kicked in, and I was feeling that something was going on.
Sure. And can you describe, kind of before and maybe currently, just to give us a sense of things that, you could do that maybe you can't do anymore, whether that's, around the house or in daily life?
Yeah, I mean, I played sports growing up. That's something that I had to stop doing around that same 16 to 18 time frame. And I used to run and jog and all of that stuff, and I cannot do that anymore. At this point in my life, there are a lot of things that I still can't do. I mean, your day-to-day things that picking up really heavy things or going upstairs or being on my feet, a few hours at a time, those are things that really affect me. And that, definitely there was this progression from my adolescence into when the mobility really kicked in, where I was very active. I was a very active child. And then all of a sudden this took a downturn. And then years later I have a son, and it gets difficult to carry him around.
Sure.
Just from all of the weight that he has to put on my body. So those are things that are really hard to do now, and it's definitely been a huge progression from around age 16 to current.
Sure. Well, thank you so much for sharing on those different issues, Aaron. Again, would like to bring another voice in this conversation. Nellie, maybe we can bring you in here. Thinking about, again, that really wide range of different symptoms and health effects. What one or a few of those, rose to the top for you as being some of the most troublesome?
Hi, I'm Nellie. I am from Washington, D.C., and I have HPP. My mother has HPP, and so does my son. And we're all impacted very differently from HPP. I put on mine, obviously, the bone, muscle, joint pain is significant. I also have a lot of neuropathy issues as well. And just to add to that side of it, for the sake of dialogue, there are aspects within the neuropathy of dysautonomia. Just autonomic dysfunction is what the doctors call it. For me, it's impacted my ability to have perspiration or to be hot or cold or flaring, where just it's disrupted the major autonomic issues in my body. And then just the widespread pain. It is deep to the bone.
So just to clarify, you mentioned both kind of, nerve pain or neuropathy, as well as, widespread, maybe even bone pain. Are those, in your mind, you're experiencing multiple types of pain, and can you just kind of describe that a little bit?
Absolutely. In some of the videos I was listening to, they really do a beautiful job of illustrating the wide range of thousands of diagnoses we can receive. And within that, the list is long as far as the additional pain elements, like having heat intolerance, or if I'm in the sun too long, my vascular system opens up too much, or if I'm in the cold, I constrict too much. So it's not something that is a pleasant experience. My skin hurts. I have widespread skin sensitivity that can't be described. I do have small fiber neuropathy taken by a skin biopsy, but the pain is it's literally from as far out as far in as you can go.
Wow. And the dysautonomia and some of the kind of, symptoms and discomforts related to that, is that something you've always had, or is that something that kind of developed over time for you?
It's a great question. It is not something I have always had. I started off as a young girl with the bone pain, and growing pains were extremely difficult. 14, I literally had to go and have a cane. But my mom, who has HPP, she was like, "Oh, it's normal." But she didn't know any differently. It's probably impacted her as well.
Yeah.
So I never really experienced that until about my 30s,
Okay.
after I had my children.
Sure. And can you maybe, describe for us, how that might impact what you can do in daily life, and just kind of, personally for you, what has that impact been of the dysautonomia?
So I can't go to my children's outdoor sporting events because my vascular system opens up too much, and I can't think straight or comprehend because of the heat intolerance that I experience. So that's hard to, it's in everything you do. Even just going outside for a few minutes, it limits me. But also, I'm a high fainting risk. And so I have fallen in a bathroom and knocked my head on a toilet before and become unconscious. I mean, those are things that I just lose that heart blood pressure component.
Yeah.
They're not things I've ever experienced before, but as my HPP progressed and my ALP dropped lower and lower before I was diagnosed,
Okay.
these were events that were becoming, that were increasing.
Sure. Well, Nellie, thank you so much for sharing that, and something we haven't heard as much about today. I do see that we have a phone caller. We have Laura from Las Vegas, who wants to share some of her most troublesome symptoms of HPP. So, Laura, I'd like to welcome you to the program. Are you with us?
Thank you. Yes, I am.
Welcome.
Thank you. Would you like me to start by just kind of giving a quick overview of my
So yeah, we'd love to hear
diagnosis?
what maybe are when as you're thinking about the range of different symptoms, what is maybe something that's most troublesome or bothersome for you or your loved one?
Okay. Well, as a child, the problems I faced back then were much different than what I face now.
Sure.
As a child, I had delayed walking. I didn't walk until I was almost 2, and I had a horrible time in PE class in elementary school, and just had a lot of pain, was very slow, couldn't keep up in the athletic activities. And it's interesting because I recently ordered my medical records from my childhood, and I realized that they were investigating whether or not I had cystic fibrosis at one point. I also lost all of my front, upper, and lower teeth by the time between the ages of 18 months and the age of 4.
Okay.
Lots of growing pains as a teenager. But then it kind of all went away and life was normal. And then around the age of 45, I just had a horrible time with fatigue, and I felt like I couldn't get my brain engaged to, get through my work. I did a lot of grant writing and had to have a brain that could think and write. And I just had a really hard time working. I started going to doctors, and I was also really tired. But every doctor said after every test, yeah, there's nothing wrong, and they always just wanted to prescribe antidepressants and all sorts of things that I knew I didn't need. So I just kept going to different doctors, and fortunately, eventually wound up with an endocrinologist who knew about hypophosphatasia and diagnosed me. And then the interesting thing in my case is that I didn't have a lot of the bone issues that are so commonly described in all of the materials.
Okay.
I did have a couple of very minor fractures, but it was because of, stubbing my foot on something or trying to play football as a kid because I had to in PE class. So in my case, my issues were more neurological, with the brain fog and the fatigue, but also I would have these shooting pains, like when I was making a bed, I'd have shooting pains in my arms, or when I stepped on a ladder, I'd have shooting pains in my feet and up my leg. And I thought that was bone pain, but when I finally made it to the Mayo Clinic to have a full evaluation of all of my symptoms, it turned out that the doctors think that's nerve pain, and in working with a peripheral neuropathy specialist in Mayo, because of the neuropathy I had in my feet and hands, she did a special kind of test, and the result of that was that they think I had a form of vitamin B6 toxicity. She said the pattern of my test results were very similar to someone who is having nerve problems because they've been drinking way too many energy drinks. And so once I got on the treatment with Strensiq, my vitamin B levels came back down to a normal range, and I no longer have neuropathy, and I no longer have these strange pains upon exertion. So the nerve aspects of this disease are definitely something I hope will be investigated more in the future.
Yeah.
I also have a lot of trouble with heat and cold intolerance, like the last caller. If anyone is, and then the other thing too is that I've had a lot of problems with calcium deposits in my breast tissue, which has necessitated several breast biopsies, which have all been negative, but the doctors think they're calcium clusters that can indicate breast cancer, but so far they've just been calcium deposits that I think are probably connected to HPP.
Yeah, and Laura, if you don't mind me asking, I'm glad to hear that neuropathy is under control now, at least from what you described. But when you were experiencing that, were you also still experiencing the brain fog and fatigue at the same time? And if you were, how would you kind of, rate those kind of relative to each other? Which things were most impacting you on a day-to-day basis?
I would say the fatigue and brain fog were far more of a problem than the shooting nerve pains,
Okay.
just because I could avoid the shooting nerve pains by not doing things that I knew might cause them.
Right. Okay.
So I would purposely avoid stepping on anything, that like a ladder that might cause those pains, or lifting heavy things. But with the brain fog and fatigue, there was no way to avoid that, and it really made it hard to work.
Right. Wow. Well, Laura, thank you so much.
And the fatigue and brain fog has also improved tremendously since I got on the treatment as well.
Oh, well, that's great to hear. Well, I really appreciate you calling in, Laura. I do want to bring in another caller that we have. We have Jennifer from Florida, who is, sounds like maybe both a patient and a caregiver. So, Jennifer, I would like to welcome you to the program. Are you with us? Jennifer.
Hi there.
Welcome.
I'm calling in. I was responding to the question. Pain is a big thing for us.
Okay.
All of us. I have 3 girls, and we all have the diagnosis, though our symptoms and severity has been a wide range. One of my daughters didn't really have too many things. She did have breathing issues as a baby, though we were all diagnosed with childhood. Another one has already broken 27 bones. She follows closely to my sort of HPP outlook. I've had more than 40 broken bones. Everybody just blamed us, told me that I was clumsy.
Wow.
So there's a huge mental component to this. And then my youngest is just turned 18, and she has big issues with just mobility. She was actually the one she was a lot later walking than the other 2. But somebody mentioned that the Maya mentioned on her talk that she looks normal. And I still get that. I still walk in and I say, I have hypophosphatasia. I try to explain it. Nobody wants to hear it. The mental component for us is a really big one, because I remember feeling suicidal when I was 8.
Wow.
I didn't think I fit in. I didn't understand why I was slower, why I couldn't do a lot of the things, even though I tried really hard and I did play 2 college sports. I wasn't diagnosed till I was 55. And it was because of my daughters that I kept marching them around to, oh my gosh, so countless doctors who said that, we looked fine and they didn't seem to have any problems. That either we played too hard, we were clumsy.
And this was because of the lots of fractures and broken bones that driving that.
Yep, and they just there's no way to put a number on pain. I mean, now they have the scales, but they don't believe you.
Right.
That's another thing that we all dealt with, and it's just been a really difficult thing. And taking, as a single mom, taking my girls around because their father actually told the judge in our divorce that I was making my children sick and that I was causing them to break their bones. Wow. So there was a whole Munchausen by proxy. They tried to tell me that I was causing my kids to fracture. I mean, it was it's been a hard road. It's been really, really crazy, and we're happy that we have a diagnosis now, and at least now, you know, they can think about whether they want to have children. But you know, with this, knowing that they have this, I'm happy to have this group. I'm happy to be on Strensic now. I am feeling somewhat better, but I grieve for all the years that I was just told this was all my fault.
Right.
And that's all I wanted to add, is just that I'm so grateful for this group and for these people that, you know, support one another on Facebook. And but that's our story.
Well, thank you so much, Jennifer, for calling in and sharing that. And you know, those impacts, you know, with other family members and you know, and socially, kind of in life, are really real. And so I appreciate you highlighting some of those for us as well. I want to bring one more caller into the discussion at this point before we, you know, go to some of the written comments that I know have been coming in as well. I'd like to go to Travis from New Jersey, who's a caregiver and wants to talk about some of the biggest impacts of the symptoms and health effects of HPP in his family. So, Travis, are you with us?
Yes, hi, I'm here.
Hi, welcome.
Thank you very much. I appreciate it. I'm glad to be a part of it. Glad to see that this kind of discussion is being had.
Yes. So, are there any certain of the you know, symptoms, health effects, you know, consequences of HPP that your children have experienced that you'd like to highlight for us today?
Yeah. So I'm a caregiver. One of my sons has HPP, and he's had some skull issues in the past as a result of it, and one of them including Chiari malformation, which caused a large pocket of fluid in his spinal cord called a syrinx. He had multiple decompression surgeries, which caused him to have to spend months in the hospital.
Wow.
You know, really, you know, we worry that over time this is going to impact his spine, his back, shoulders, arms, legs, causing, you know, even more pain or weakness or even, you know, loss of sensation. Of course, the surgeries are scary and stressful to everybody involved, in, you know, my son and all the family members involved and the siblings. One time he had an allergic reaction. He got meningitis after the surgery. He was hospitalized for 6 weeks. So, you know, this is a big concern as a current threat to his health. And then indirectly, you know, being in the hospital for that long, you know, he gained weight, and, you know, there's all kinds of things that come along with that, with depression and you know, risk for diabetes and all these things. So it's just a lot of stuff piling on top of another.
Yeah, no, for sure, Travis. Could you maybe tell us a little bit about what you know, was necessitating, you know, these surgeries that, of course, you had this whole host of different impacts and you know, were challenging for your son?
So I'm sorry. Could you repeat that? Yeah, I'm having trouble. Like you're breaking up or something, and I can hear like every other word.
Oh.
I want to be respectful of your question. Can you try that again? Sorry.
Absolutely. Yeah. My question was just, you know, could you give us a little bit of context of, you know, you've talked about referred to a number of different surgeries that your son has had. You know, could you tell us a little bit about what was, you know, what health problem or issue was, you know, resulting or needing that surgery or surgeries?
What health resulted from the surgery? What health issue resulted from the surgery? Is that what you said?
Sorry, I guess that might be breaking up for you, so I'm gonna move on at this point. I apologize that we have this connectivity issue. So I'd now like to turn to Deborah. I know that we have been getting a number of written comments coming in. What are we hearing on this topic of direct symptoms and health effects?
Yeah, so we're hearing a lot of similar themes, James, specifically around pain. Sandy from Campbellsport, Wisconsin. My biggest symptoms are pain in my joints, tendons, ligaments, muscles, achy bones. I have to be on a hard surface to walk. If I'm not, I have to take smaller steps and I need to hold on to something if available. Catherine from Aldie, Virginia. I have daily joint pain in my knees, hands, wrists, and shoulders, to name the worst. More pain comments. Nicole from Slippery Rock, Pennsylvania. I've developed scoliosis and bulging discs causing back pain and migraines. I have toxic vitamin B6 levels causing migraines, mental health issues, and neuropathy. I have joint pain, fatigue, and weakness. And then another one from Jennifer from Fernanda Beach in Florida. As a patient living with HPP, I can vouch that the bone pain is excruciating. Additionally, my joints are weak, and it seems my ligaments and tendons are even weaker. They tear too easily. I've already had 22 surgeries and have broken more than 40 bones so far, and have at least 3 more surgeries in the offing. So lots of themes around bone pain, muscle pain, joint pain coming through in the comments.
Absolutely. Well, I want to thank everyone who's been writing in. We'll continue to read some of your quotes throughout the day today, but even if we can't get to those, know that we will be incorporating those into that Voice of the Patient summary report. So I'd like to broaden the discussion. We've been talking a lot about these range of different symptoms and health effects, which we've learned already can really vary over the course of people's lives in terms of what they're experiencing maybe in childhood and then into adulthood. But we want to also, as we've already started to hear, understand how HPP impacts your daily lives and the activities that are important to you in daily life. So to help us think about that topic, we're going to go to another polling question. So you can pull your phone back out, go to that browser, go to that maybe tab in your browser that you'd opened up, go to www.pollev.com/HPPPFDD. Here we'd like to know what specific activities of daily life are important to you or your loved one that you or they are not able to do or struggle with as a result of hypophosphatasia. And we want you to select the top 3 of those activities that are most impacted. The options are A, attending school, B, biking or playing sports, C, driving, D, self-care, E, meal preparation, F, sleeping, G, walking or running, H, working and having a career, I, attending social events with family or friends, or J, some other activity in daily life that's important to you or your loved one that they're not able to do or struggle with due to HPP. So we'll give you a few more moments here to get your responses into this question. As it stands, it's looking like some of those activities that are important to you and your loved ones that are most impacted include walking and running, working and having a career, biking and playing sports, attending social events with family and friends, and sleeping. So those are some of the top ones, but what also stands out to me is that every single one of these is reported as a top 3 important activity that's restricted in some way as a result of HPP. And so, maybe it's a single one of these symptoms that's making this more difficult for you. Maybe it's a constellation of the different things you're experiencing. We'd love for you to call in, write in, share those experiences with us. Again, if you would like to call in, I'll invite you to dial in at 1-703-844-3231. We'd love to have you share some of the impacts in daily life at 1-703-844-3231. And so while people are calling in, or maybe while you're submitting written comments, I'd like to come back to our Zoom panel and maybe start with you on this one, Kirsten. As you're thinking about, the different impacts of HPP, what has that made difficult or made impossible in daily life for you?
Hi there, James. I'm Kirsten. I am from Florida, and I am living with HPP. And I would say the number one thing that I chose was working and having a career. I was a teacher for 20 years, on my feet all the time, from morning till night, and it got to the point where I was in a cam boot every 3 months. At one point, I was in 2 cam boots. I broke my femur. I had both my heels broken, just multiple metatarsals, etc.
Wow.
So I never got any rest, from being on my feet. And that has really impacted me because, I love teaching. And then I went virtual. And believe it or not, I have the same problem with my hands. I had problems with my metacarpals. They were in so much pain. The pain also, a lot of people spoke about chronic pain and the bone pain. That's something that really has affected my ability to work because it affects my ability to sleep. I can't sleep at night very well. I wake up multiple times a night with pain. And then that affects, it's like a rolling sort of thing. It affects your day because you're fatigued. Then you get brain fog, you don't think or comprehend as clearly. So all of the things sort of tie in together. So work is my biggest, thing. It has definitely impacted my work. And then I'm also athletic. I used to love to run, and it just sort of stopped me in my tracks. I can still do some activity. I've had to do other things, but it has taken away the two things I love, teaching and running, physical activity. So it's had a huge impact on my life.
Sure. And Kirsten, some of the impacts on, just your ability to teach and your career, has this, resulted in you having to cut back or stop it all? Or is it just, it's making it just more challenging to get through, each day in doing it? Can you just describe that a little bit?
Yeah, I no longer teach. So I had to stop teaching because like I said, it was constant pain. And like I said, I went to try even virtual teaching, and even the pain from working on the computer became so much. So now I spend my time volunteering and advocating, for all of these people and for my son, my child that has this, and for other people's children. That's my focus, now.
Yeah, another interesting thing you described was just kind of this interconnectedness of all of these different, symptoms and health effects. And you talked about, waking up at night and kind of sleep disturbance. Is that something that, it happens to you every night? Is it, it seemed you described it as being related to your pain. So is it, when on days where you have worse pain, those are the nights that you don't sleep as well, and is that like an every night occurrence, and it's just the number of times you wake up, or are there some nights where you can sleep through the night?
Well, it's rare when I get a good night's sleep, but so for me personally, everybody is different, of course, with hypophosphatasia. But for me, I go through periods where I may have a little less pain. And like right now, I've been in a period of about a month and a half where I have severe, bone pain that comes and goes. So, and I can't predict, one morning I can wake up and this just happened a few weeks ago. My back was so bad, I couldn't even walk.
Wow.
The pain was so severe, I thought that I might vomit. I mean, I think it's a CPPD, I get that in my feet, in my hands. So that's the hard part about this disease, is that, you cannot predict, like how every day or how every week is going to go.
I see.
And that makes it very difficult to take part, like sort of in a normal type of life where you go to work and you come home, and everything is depending upon your symptoms, basically, of how your day is going to go, which is kind of hard.
And have you changed at all, or has there been an example that maybe you think of where that inability to predict when you're going to have maybe those really bad days with that pain is impacted planned activities? I know obviously you described work, but even beyond that?
Yeah, so socially it has affected me because, people will want to go out and make plans to go places, and I want to say yes, but I really don't know. Like, okay, is this going to be a day where it's just going to be really difficult for me to go and pretend, like I think all of us, most of us live with the chronic pain and are used to it.
I see.
But like the fatigue and everything, it makes you, sometimes it can make you a little irritable. It does that to me, because you're always in pain, you're tired. And so your tolerance level sometimes isn't, all that great. So you'd rather just sort of stay home and, not, I'd rather be out and be cheerful with people and,
Right.
And happy and not, so that's been very difficult for me socially. Like I used to have a huge, ton of friends that we'd go out all the time. And now that this disease has progressed, I've sort of, limited, my circle more.
Sure. Well, thank you so much, Kirsten. Scott, I'd love to bring you in on this as well, thinking about, anything that maybe is difficult to do or impossible to do as a result of living with HPP. What comes to mind for you?
Well, Scott, I'm from Central Florida, and I'm living with HPP. Like a lot of people, I wasn't diagnosed till later in life. So a lot of the symptoms and stuff I have are attributed to, other things. They always had another excuse of why something was going on or something was happening. But at 60, I was finally diagnosed and started as transit shortly after that. But like Christian was saying, the daily effects is the, what kind of a mood for me, is things put me into, whether I'm in a lot of pain or, depression is a lot. But just not being able to do the things that I was able to do, more accurately or more, easily, than I was younger, things that, would take me a few hours now take me days to accomplish. So that's a big thing for me. Frustration of that. But now knowing that what's going on has been a big relief.
Right.
Not so much as far as what's going on, but just knowing that what's happening and why it's happening.
Right.
So that's been a big thing. The community that we share has been very helpful because they share their experiences, which identify with, and that helps me to be able to motivate myself, which is sometimes hard to do with fatigue. That's probably, if my daily things were pain and fatigue, is probably the biggest things that I fight through. Fatigue probably being more than the pain because it just makes me have to fight even harder to try to get through, that bout of fatigue, and, having to rest a lot, sit down a lot, not being able to continue, even though I have a task that I want to accomplish. I still have to stop in the middle and wait to continue to do that, until I'm able to do it.
Yeah, and Scott, you mentioned along those lines that they're, pain and fatigue have made it things that you used to be able to, maybe do in a single day, you've had to stretch out or spread out over the course of multiple days to complete it. Can you maybe share an example of one of those types of things?
Well, I'm an avid automotive enthusiast, and so I have over the years several vehicles that I've, antique, classic vehicles that I enjoy dealing with now. And obviously, since I'm not working anymore, I have the opportunity to participate more in. But it's been more as a spectator, as a participant, and having to, limit myself on, what I would like to do. Obviously, I would like to do a lot more, but I'm unable to because of, the issues that I face every day. So, the time, you just don't have enough time to accomplish the things that you would like to. So you have to limit, and try to get in perspective, the reality of your situation and what you can do and what you can't do. So, just, for me, I live on 2.5 acres that we've recently built a new home on, and I have a large shop that I have out back, but just the difficulties walking back and forth to the shop.
Oh, wow.
Having to watch because it's uneven ground, so it's not a paved or, even area to walk. So that's, those are kind of the things that I have to watch out for. There's a couple steps to get into the house, that I have extended steps so that I can manage those better. And those kind of things, things that I try to always have to constantly think about my movements to make sure that I'm not, falling or tripping or something that because gait is a problem with me and balance issues also.
Wow. Well, Scott, thank you so much for sharing all of that. We have a phone caller I'd like to bring into the discussion. We have Allison from Virginia, who is herself living with HPP, and I'd love to hear from her some of the things that have been most impacted as a result of the condition. So, Allison, would like to welcome you to the program. Are you with us?
Hi, I am. Thank you so much. Thank you for this opportunity to share and to have this discussion, and to all the panelists as well.
Sure. Well, thank you for being here. So,
I guess I can just, okay, go ahead, sorry.
No, I was just going to say, is there anything that comes to mind as maybe something that's important to you that is more challenging or maybe impossible as a result of HPP that you'd like to share?
Yeah, so I think, in talking about some of the top symptoms, for me, it was the fatigue, the brain fog, the neuropathy, and the joint pain. And these symptoms started really manifesting strongly about 7 years ago.
Okay.
And I saw a number of, primary care doctors who basically dismissed me, thought the same to some of the other callers. Maybe it's, anxiety, maybe it's in your head. And finally got referred to an endocrinologist again 8 years ago, around 2014. And, they said at that point in time, the low ALP was actually showing in my blood work. And I kept pointing to it and saying, what is this? Or can someone help me understand if this could be part of it? And they said, no, it doesn't seem you have the symptoms. It's a very rare disease. We wouldn't test you for that. And so it's really unfortunate because it was actually there in my blood work the whole time. And so we adjusted some of my diet and nutrition. I saw a dietitian. I took out gluten mainly, and that actually helped tremendously with the neuropathy and the brain fog. And so I thought that I had been doing well for a very long time until last year in 2021. So unfortunately, during the pandemic, I was still experiencing extreme fatigue, lack of concentration, brain fog, went back to a different PCP this time. And I guess by the fate of the universe, I got her last appointment before she left the practice. She was a DO, doctor of osteopath. She referred me to an endocrinologist who just happened to specialize in HPP. And upon my first meeting with that endocrinologist, she had said, I think you might have this rare disease, and I want to test your B6. And sure enough, I had 2.5 times the B6 level, and I was diagnosed with HPP last year in 2021. I did have symptoms as a child, my mom would say around 2 years old, where the calcium was not depositing in my hands. My bones had not maturated properly in my hands, and missing some growth milestones, potential for failure to thrive. And so it did kind of start in childhood, but again, manifested later on in my 30s. I'm now 44. I would say for me, one of the biggest things that has been impacted that I worry about, I guess, my fear of being impacted is being active and running and walking. I've been very active all my life, played sports, worked for a large sports brand, top Fortune 500 brand for years, and have done many half marathons and races, and now seem to be getting a lot more hip pain. And I think for me, I am on Strensiq, and it has been helping. I've been doing that over the last year. And I will say that, like some of the other callers, I really do hope that more of the neurological research and symptoms will kind of be, I guess, diagnosed or learned. I do think that possibly I did have ADD all my life too. I'm not quite sure, but I'm in a very competitive field, working with highly competitive companies, and like other callers, I do struggle with the concentration and the focus and the brain fog still.
Yeah.
Not as much as previously because Stringent has helped, but would love to kind of, dive deeper into that neurological component. And the other component is really understanding how it impacts other organs.
Mm-hmm.
I'm starting to have some heart, some issues. They've found some mild calcification in my heart. And I wanted to hear if any other patients have been experiencing issues with other organs as time goes on, especially as adults.
Yeah, well, Allison.
And that's basically it. Thank you so much for the time.
Yeah, no, thank you so much. And I appreciate hearing about, some of the impacts that you've experienced, both with, the hip pain and how that's impacted you as a very active person, as well as, the ADHD, which we haven't heard so much about today, but how that impacts, kind of your career as well. So I want to thank you. Would like to bring in another caller into this discussion. We have Christine from Rochester, New York, who's a caregiver. So I'd like to ask Christine to share maybe what is the thing that's most impacted in daily life for her loved one living with HPP. Christine, would like to welcome you to the program. Are you with us?
Sure, I'm here, and I'm so glad to be here, so thank you for the opportunity.
Oh, thank you.
Like you said, I'm Christine from Rochester, New York. I have a son who is almost 18. He has childhood form of HPP, and we noticed with him, he woke up from a nap at 10 months old and lost his two bottom teeth. So that was our first sign after countless appointments with doctors who thought we were crazy and that he must have just bumped them. We were given the name of Dr. White. So we were lucky to kind of be taken under the wing at Shriners. And with Ryan, it was chronic daily bone pain, joint pain, especially his knees. He had the gated walk, multiple fractures. He fractured his one wrist several times, and he ended up with bone marrow edema within that wrist at the growth plate. The chronic migraines, the brain fog, like everybody else, right? So it's a variety with everybody. With Ryan, he also, a lot of people mentioned ADD. We had teachers that wanted us to medicate Ryan, and I, in my gut, did not feel that that was what he had. So we went for multiple testing, and he was diagnosed with auditory processing disorder, as well as pitch tones. So when the teachers would think that he wasn't paying attention, it was that there were different issues with the pitches that he wasn't hearing, or the auditory, it was just a slower way of processing. He had to sit, a certain way in the classroom that would help him. So, like I said, the chronic pain is the most significant impact on his daily life. He had no teeth for the longest time, so speech impairment. He couldn't participate as a normal child with activities that everybody else did. Something that we take for granted is simple walking, going up and down stairs. By the time he was 11, it was like he was a 90-year-old man.
Wow.
So watching your child just to be debilitating in front of your eyes was hard.
Absolutely.
So I'll probably be the first one to cry on this one. It's been a struggle, and like I said, I'm glad to be here and for somebody to be listening to the parents of these kids, because we want a future for them.
Yes.
Thank you.
No, thank you, Christine, so much. And, we really appreciate you sharing. It's really important that we all hear these collective experiences. So, but while, we've heard now a lot of the different impacts, both in childhood and in adulthood, across daily life, I do want to recognize that I know you all are likely also thinking about life living with HPP into the future. And so I want to expand that into our discussion as well. So would like to, before we go to a polling question on that, check in, though, with Deborah, in terms of any other impacts on daily life, is there anything maybe we haven't heard much about, or maybe something that builds on something we've heard from written comments?
Yeah, I just think some examples of the daily impacts that we see, a couple themes. Again, Taylor from Houston, Texas, extremely debilitating fatigue, muscle weakness and pain, daily headaches that impact every part of my day. I have to plan around my fatigue. I can only walk short distances. Then we also have Nayla from Belgium. Fatigue affects me in almost every aspect of my life. I deteriorate at a steady state. The fatigue gets worse every day, and the bone pain can get very intense. In the past 5 years, I've gone from being able to hike 5 kilometers to not being able to walk 500 meters, and now being in a wheelchair part-time. That with horrid fatigue, the life I have is no life at all. Richard in Oakland, Michigan. My son's pain and fatigue impact his mobility, and his brain fog make it impossible to drive or do the things he loves, like reading and playing the piano and guitar. More recently, with his expanded and more severe symptoms, his quality of life has been reduced to the level of a shut-in, which has had major impact on the family, his wife and I. We have no longer feel comfortable leaving him for vacations, nor is he able to come with us. His condition has had a profound impact on us all. And then Ed from Canada, he says he had to stop working as it's impossible to work in the physical condition this disease puts us in. This also affects our families who rely on us to be the earners and now cannot.
A number of really tremendous comments there, so I want to please encourage you to keep those coming as well in that written comment box under the live stream window here today. So now as we think about that topic of the future of living with HPP, we'd like to go to our final polling question of this morning's session. So please go ahead, go back to pollev.com/HPP PFDD. We'd like to know from you now, what worries you the most about you or your loved one's condition, thinking about their future living with HPP, and you can select up to 3 of those greatest worries. The options are A, bone fractures, B, short stature, C, that symptoms will get worse, D, falling, E, impacts on your or their career or schooling, F, medication intolerance and side effects, G, worsening dental issues, H, the need for surgery, I, worsening pain, or J, some other worry you have for yourself or your loved one living with HPP about their future, thinking about their life living with the condition. And again, you can select up to the top 3 of those greatest worries. So while results are still coming in, as it stands, it looks like some of the top worries that our audience has today are that symptoms will get worse and that pain will get worse. So, we've heard a lot about the different symptoms, including fatigue and brain fog, and we've heard a lot about different types of pain. And so that we're seeing here that perhaps number 1 and 2 worries that people have are that those types of things will get worse in the future. After that, we see that bone fractures, impacts on schooling and work, as well as medication intolerance and side effects are kind of maybe a second tier. But as with each of our polling questions today, time and time again, I keep seeing that people are selecting the whole wide range of these different issues as some of their top ones, and that does not, that continues here as people are looking towards the future and thinking about their worries. Every single one of the options here is in somebody's top 3, and in fact, a number of people's top 3. So we'd like to continue this conversation about worries for the future. And I'd like to, go to our Zoom panel here and maybe see with a wave of a hand, who has, important worry that they would like to share with us today. Lindsay, let's start with you.
With Evie being a teenager, I worry about her independence. Right now, if we're in crowded spaces, I'm sort of lingering around her to make sure she doesn't get pushed down, whether she realizes it or not, or Even when she goes out with friends, I know that she is anxious to go places without me. If she would have a seizure, if she would fall, what would she do? And so fast forwarding into high school and college, I know those are things that she wants to do, and I know that she's unsure if those are things she'll be able to do. So she does have some of the learning disabilities. She has hearing loss, so her auditory processing is also greatly impacted. So just looking forward, hoping for her that she can do the things that she wants to do, but knowing that she will have limitations. And also hoping that she has the confidence to try those things on her own. It was interesting hearing Becky talk about the surgical PTSD that her daughter Juliana has
Yeah.
on the video. Evie's had 12 surgeries, and she's had a lot of dental work done. I know that those cause her a great amount of anxiety, and also being places without us. I like without her dad and I haven't not been present when she had a seizure. Like one of the callers said, I really don't leave her very often. So she comes with us, or she's in a school setting where I'm close enough that I can get there in a flash. So just that independence factor for her is a huge future worry for me.
Yeah, no, I mean, I think that's really important, Lindsay. And, you kind of talked about a number of aspects of what might drive our independence, overall, abilities, but also some of these, really acute things like seizures and falls. So appreciate you highlighting that range of things. Nellie, what maybe stands out as a biggest worry for you?
My grandmother had HPP and she committed suicide from the pain of the disease and the progression of it. And she was 69 years old and she was in her 40s and better health than I am today. And so I have great concern about what the progression of the disease looks like in the future. And then on top of it, the worry about being on an enzyme replacement therapy that has a high ALP and the long-term consequences of just being on a medication that seems like high ALP is something that's not a good thing if you are talking to a doctor. So there's great concern about being on a medication that has that consequence. And it's just kind of an unknown.
Sure. And in the first part of what you were saying, Nellie, you were talking about, worrying about things getting worse. Were you specifically referring to pain, or were you referring to, something else?
Yeah, so when your body has got autonomic failure happening and or other disease progression or your bones are, frail, you just don't really know what I didn't have that 10 years ago.
Yeah.
So it's really, I mean, for women, there's menopause and there's a big component with what happens to our bones after that period of time. So, so it's scary in that sense.
Sure. Thank you. And Aaron, I think I saw you raise your hand as well. If something you'd like to share on worries and concerns for the future.
Yeah, I mean, I think that I fell in the category that was probably the top three, the pain and the progression of that. But what I wanted to add on that is that what drives that is the fact that if my symptoms and my disease progresses further to a point where my mobility is worse, I do have a small child and I have 2 children on the way. And that is something that will not allow me to be in their life as much as I want to be. So the overall concern is that this will progress to a point where I can be the father that I want to be to my children and be as active in their lives as I want to be. So that's the worry that I have, but it's driven by that. So it's very concerning, can be upsetting some days.
No, absolutely, Aaron. And again, just so I fully understand, is that mostly the pain that's you're worried about being able to participate, or other aspects of HPP too?
I mean, I think the part of it is the pain, but I think the progression of the disease, the mobility aspect of that, that will come from, just progression of disease. I mean, yes, the pain will limit some mobility, but the overall, if I ever need assistance full time in terms of crutches or walker or wheelchair at some point in my life, I think that will, it's definitely gonna be the biggest impact on my relationship with them.
Yeah, absolutely. Kirsten?
I'd just like to say, just like Aaron, and Nellie said, that is one of the biggest concerns for me is the unknown, about the progression. Nobody can really tell you, how it's going to progress for you. And so the fear of losing your mobility and being more dependent, on people is a huge fear.
Yeah.
And also for my child, the same as Lindsay, my child is grown, but he might present later in life like I do, and he might need to be on treatment. And what is that going to look like? So there's all kinds of fears for yourself and for your children. And I think a lot of it is because they're unknown, circumstances where we can't predict, what is going to happen with a certain mutation or, if you treat with a certain medication, et cetera. So
Absolutely.
I concur with all of that.
Oh, well, thank you so much, Kirsten. I do want to bring a phone caller that we have into this discussion as we think about some of the worries and concerns for the future. We have Michaela, who's actually calling in from Australia, who's living with HPP. So Michaela, I'd like to welcome you to the program. Are you with us?
Oh, yes, I am. Thank you.
Welcome.
Thank you. Thanks for allowing this opportunity to bring the HPP community together. I just was considering some of the impacts, but also the worries that I have having HPP myself, but having 4 of my children also with HPP. I'm finding that my biggest worry is that I see more severe symptoms in them at their age now than what I had. And so I worry how HPP is going to affect their progress both physically and mentally into the future, and how that, I guess, being in a country where treatment is not available at the moment, how that is going to play into their decisions as they grow into adulthood, decide on families, etc.
Yeah, and Michaela, as you were mentioning that your children have some symptoms or maybe more severe symptoms than you had, when you were their age, is that, is that mobility related? Is that, what really are those symptoms that you were referring to?
Yes, like HPP, I suppose in a big family where you have 4 of my children have symptoms, they're all at varying degrees. Pain across the board for all of them, but they all have had different breaks, fatigue, mental health issues for some of them. I think I see my youngest, who is 15, and we had a bit of a scare last week, had to go to the doctors again, and I thought, gosh, we might finally get through a year without a break, and of course there's a broken finger. So I didn't have as many breaks as I've seen one of my children have. My daughter, I know she struggles with fatigue and pain. They don't want to prescribe her any more concentrated pain relief medication because she's too young to go on opioids. And that's a big issue, and I see that as something that really worries me, what options are out there for my children to have good I guess, medical care.
Right. Wow. Well, Michaela, thank you so much for sharing that, both, in terms of, I think emphasizing something we really heard throughout the whole day today, which is just how variable it can be even within, individual families living with HPP, but also, how that then relates and informs your worries and concerns for the future. As we're reaching the end of our time that we have together on this morning topic, I do want to thank all of those who have called in. That unfortunately we didn't have time to bring everyone into the conversation, but do want to encourage people that maybe have called in to do so in the afternoon, as we'll have another chance to hear from our live audience today, but maybe we can end our discussion this morning as we're thinking about worries and fears for the future with some of the written comments that I know have been coming in as well. Deborah, what are we seeing?
Yeah, sure. Again, similar themes here, concerns about disease progression. Per Neil in Denmark, worst is that I've started to get pain in my arms and hands, mainly in my right hand, which is my writing hand. I know at some point I may not be able to walk on my own anymore. Then there's some comments on growth concerns. Brianna from Idaho Falls, Idaho, she says her son Liam has hypermobility. He currently sleeps with his feet being in what seems to be very uncomfortable positions, and he wants to stay in a middle splits position constantly and struggles to get into a crawling position. And her concern is that he continues to grow. This could lead to hip problems. And then Ashley from Deltona, Florida, as a wife of an HPP patient who works as a firefighter or a paramedic, I'm most concerned about his ability to work, which is currently our only source of income. His biggest concern is that he won't be a good father because he's anxious about participating in his children's lives as they grow up. In a rare moment when he was brutally honest about his concerns, he worries about being a burden on the family, and she expresses how she was heartbroken.
Wow. So thank you to everybody for all of this tremendous input to really help us understand what it is that you're living with and dealing with on a day-to-day basis with HPP. Thank you to all of our Zoom panelists who have been with us throughout this session, and to everyone who did call and write in. And we'll have another opportunity to hear from all of you this afternoon as we expand our discussion into understanding the current treatment approaches as well as your thoughts about future ones. But for now, we're going to take a 30-minute break, and we will resume at 1 p.m. Eastern Time. So again, thank you. Good afternoon, and welcome back to the externally led patient-focused drug development meeting on hypophosphatasia. I'm James Valentine, your meeting moderator, and I'm here in the studio with my co-host, Deborah Fowler from Softbones. And we're so glad to have you all back after such a wonderful morning of really digging deep and understanding what it is to live with hypophosphatasia. We come back in this afternoon to build on that discussion and get your assessment of current treatments for HPP, as well as your preferences for future treatments for yourselves and your loved ones. To give you a sense of the types of topics that we want to explore and hear from in the afternoon, if we could pull up our discussion questions for this afternoon session. Some of the things that we're going to be asking you to weigh in on is first, we want to know what it is that you're currently doing to manage your and your loved one's hypophosphatasia symptoms. And when we think about the different things that you might be doing, of course, we do want to hear about drug and other direct medications and treatments, but we really do also want to cast a wide net to hear about not just those things, but as well as other medical interventions like surgeries, but also maybe non-medical approaches. We've heard a little bit this morning about some of the accommodations and adaptations people have to make, as well as some of the other, different treatment approaches that might be more holistic and that you might be doing. Really anything that you might be trying or using to make living life with HPP a little bit easier, that falls under this umbrella of treatments and management approaches. So we want to know, what are those things that you're doing and trying? We want to then know, how well do those things actually treat those most significant symptoms and health effects of hypophosphatasia? So everything that you taught us about this morning, we want to get your assessment. How much help and relief are you getting from your treatments? We also know that particularly with medical treatments, no treatment comes without downsides, particularly side effects. This could also include the burden or amount of time that it takes to undergo a certain treatment regimen. Whatever it is that you might view as downsides of your treatment approaches and regimen, we want to hear about those and how those downsides affect your and your loved one's daily life. And then at the end of the session, we're going to think and turn towards the future. And while we all would love a complete cure for HPP, we want to think about that pipeline of products, that new drugs that might be coming along, and get your feedback on what would be an ideal future treatment for hypophosphatasia that is short of that cure. Or maybe thinking about this a little differently, if a new drug were to become available, what factors would be important to you in deciding whether or not to use that new product? So to get us started in thinking through these issues, we have another panel of both patients and caregivers who will be sharing their thoughts and experiences. We have Amy, Deborah, Susan, Sally, and Cannon. Amy, why don't you take it away?
Imagine the excitement an expecting mother feels and the joy racing through her body as she sees her baby on the screen during an ultrasound. Then suddenly feeling the emotion in the room change, seeing the look of confusion and panic that is written all over the sonographer's face. Now, the excitement and joy are quickly turned into sadness and worry. And that isn't even the worst of it. After what seems like an eternity, the doctor enters the room and tells the mother that if her baby lives past birth, the baby will die before they are even 1 year old. My name is Amy, and this was my harsh reality just a mere 9 years ago. I was a young mother, never expecting to hear anything close to what I was told. I was expecting to hear if my husband and I were expecting a baby boy or a baby girl and how big our baby was. But what I was given was our unborn baby's death sentence. During the remaining weeks of my pregnancy, I sought multiple other opinions. I was given options ranging from if I chose to continue my pregnancy, I would be considered high risk and monitored closely, all the way to recommending that I terminate the pregnancy. At that point, I was past 20 weeks, and even if medically necessary, it was still illegal here in Arizona. Although I was given choices, the only choice for me was to continue my pregnancy, knowing the entire rest of my time growing my baby could potentially be the only time I would have with her. Fast forward 9 years, and I am lucky enough to be able to still kiss my daughter Aubrey goodnight and tuck her into bed. Treatment options were simple to navigate because there were no treatment options. The days following Aubrey's birth, I knew something still just wasn't right. Aubrey began seizing daily, which added to the complexity of her hypophosphatasia diagnosis. She was very small, considering she was born full term. In just the first few weeks of life, Aubrey had been hospitalized multiple times. Then, out of the blue, I received a phone call from Aubrey's neurologist informing me that he had come across a clinical trial for a possible treatment option for hypophosphatasia. We jumped on the opportunity simply because with no treatment, Aubrey's prognosis was not very promising. Her bones were so fragile they could barely be seen on imaging. She was struggling to gain any weight. Aubrey was not hitting milestones as other infants her age. The clinical trial that saved Aubrey's life is what we now know as Strensiq. I would do anything I had to do to ensure my child survives, but Strensiq is not a perfect solution. Aside from the obvious of having to administer an injection up to 6 times a week, the injections are painful. The frequency of the injections makes it difficult to rotate injection sites, causing the sites to become very sore, bruised, or red. Over time, this also caused lipodystrophy at the injection sites. Finding the right dose of Strensiq can also be difficult. Finding a doctor who feels comfortable prescribing Strensiq is one thing, but knowing how to calculate the right dose is tedious. Many factors play into dosing, such as body weight, blood work, and imaging. Following up with ophthalmology and getting routine renal ultrasounds to monitor for potential calcium deposits from Strensiq can be time-consuming as well as stressful. Even with Strensiq, it doesn't eliminate hypophosphatasia from showing its ugly face. Aubrey has 2 genetic mutations and suffers from severe infantile hypophosphatasia. Aubrey still experiences bone fractures, failure to thrive, hypotonia, severely delayed gross motor abilities, tooth loss, hydrocephalus, severe central sleep apnea, and the list goes on. Aubrey has a multidisciplinary care team of over 13 specialists. Aubrey also attends multiple therapies throughout the week, ranging from 1 to 3 hours. Aubrey receives physical therapy, occupational therapy, and also feeding therapy. Due to the many factors hindering Aubrey's gross motor skills, we spend the most time focused on physical therapy. Aubrey has undergone 15 surgeries and countless in-office procedures. When I think about Aubrey's future, knowing as of right now her only option is daily painful injections for the rest of her life, it deeply saddens me. As other treatments become available, I can only hope that the treatment options have less of an impact on her everyday life, her mind, and her body. I hope one day she can have even just a single full day of being pain-free. Lastly, with me being a carrier of hypophosphatasia, as well as my son Maddox, who is 8 years old, I fear if either of us need treatment at any point, what that would look like. I also worry that if I need treatment later in life, how that would impact my ability to be Aubrey's primary caregiver.
My name is Deborah, and I live in New York. I was diagnosed with HPP very late. I was in my 60s. I recall being told by our family doctor that I had growing pains about 10 or 11 years of age. Nothing more. Last September, I started teriparatide, a generic version of Forteo, daily injections after a difficult 1.5 years on Strensiq. I was not able to move or get out of bed on my own during some of the initial time that I was on Strensiq. The situation did subside somewhat, but over the course of being on this medication, I would feel as if I was being pushed backwards when I walked. I would have to stop. I was extremely slow, as if I had aged decades. Now on teriparatide, I have regained some normalcy, though varied in my level of activity. This medication is prescribed to treat severe bone loss. I was diagnosed very early with osteopenia before menopause, and soon after diagnosed with osteoporosis. I have no idea if this particular medication is helping. Originally, upon diagnosis of osteopenia, I was given Fosamax for over 7 years, increasing the dosage continually. It did nothing. I saw many doctors for fatigue and pain for years. I was told I was depressed, had fibromyalgia, an active toddler, etc., etc. Prior to Strensiq, I was given Prolia, a timed injection every 6 months to stimulate bone growth. Nothing. I lost 2 inches during those 2 years. Originally under 5'2", every inch matters. That doctor and several others, specialists in the field of endocrinology and rheumatology, commented on my low alkaline phosphate, but said to forget about it. They didn't know what it meant and didn't think it meant anything. Google would have been very helpful. Last year, I had a joint replacement. After multiple years of pain, limited use, and physical therapy, my arm literally got stuck in space. I couldn't move it. A large calcium deposit had grown around the shoulder joint to protect the area. It had to be removed. I have calcium deposits all over my body, from neck to feet, some visible, some felt when I lean against the chair, for example. I am told this is the body's attempt to replenish bone. Unfortunately, these deposits are in the wrong place. Besides bone on bone and the shoulder joint, this issue had to be addressed and surgery became essential. I stopped Strensiq in May of 2021 at the time of my surgery. Slowly, very slowly, I've gained some limited strength and am trying to add muscle to support my body. I continue to lose inches. Exercise does help. I try to limit pain medication. I've used lidocaine patches, steroids and non-steroid drugs, ointments, acupuncture, massage, chiropractor, and other bodywork expertise as expense and level of pain allow and necessitate. I limit my activities, unfortunately, as a coping strategy. As I mentioned, I do not know if my current medication of daily teriparatide is working. It has been almost a year. I must be on this drug for at least 2 years. This medication is for bone loss only. An upcoming DEXA test will hopefully show some result in the next month. I'm told this drug works with HPP patients. I'm also told that my particular mutation exists in 3 other patients in the country so far. My doctor mentioned this to me after a major endocrinology conference and consultation with another endocrinologist who is a specialist with HPP. I do not know the other patients with my mutation, nor are there any similarities in our background. I continue to work. I'm an artist and maintain my studio and practice. My ability to lift materials, bend, and move in general, that with extensive fatigue, is challenging at best. I am not working, nor have I ever worked at the capacity that I wish. Walking, stretching, moving, resting all help. That and focusing on other more positive things. Pain and loss of mobility affect every day of my life and limit my activities. My level does change and vary, but I've never felt that I was totally engaged in life as I wish, as if a life half lived.
Hi, I'm Susan. I was diagnosed with hypophosphatasia within 3 months of my birth in 1960. There was no treatment available for HPP. The specialist told my parents I would not live past my first birthday, and if I did, I would not walk or talk. My first known fracture happened when I was 6 months old while taking a nap. Like every other 6-month-old, I tried to roll over in my crib and I broke both of my femurs. X-rays at that time showed I had 7 other fractures. My parents nor my doctors were aware of at that time. It was thought that some of the fractures happened in utero and during birth. When I did reach the age of 3 years old and had multiple fractures and reoccurring bouts of pneumonia, the doctors thought they diagnosed me incorrectly. They changed my diagnosis of hypophosphatasia to osteogenesis imperfecta with unexplained low alkaline phosphatase. Since this was the next disease that fit closely to my symptoms of low muscle tone, failure to thrive after birth, and fractures. With this new diagnosis, there was a new procedure that could keep my long bones from displacing. It was a surgical procedure that placed an internal rod down the center of the long bone, and they did at least 3 osteotomies to straighten the deformities caused by the rickets. This surgical procedure took 4 to 6 hours. Then you were placed in a spica cast from your armpits to your toes for another 3 months. Once the bone healed, I had 9 weeks of rehab to get me standing and walking with crutches again. It took a good 10 months before I was fully mobile again, and by this time I would fracture or need a new type of rod to support another long bone since I was growing. These procedures happened about every 18 months to 24 months as the soft bones would pull away from the support of the rods. Because of this, it made it difficult to maintain a job. The amount of 6 days I had to take off just for the healing process would usually get me fired. As I aged, the degenerating part of HPP became more than just fractures. The joints and the spine degeneration caused my health to deteriorate. I needed oxygen at night because my ribs were disappearing on x-rays, making it hard to breathe when I laid down. My social and ability to work was impossible at this time. When I was 54 years old, I was able to take Strensiq. Those shots totally changed my life and every aspect of daily living for me. I went from fracturing 3 long bones a year to just small fractures that didn't need any surgical fix, just minor splinting. And within the first 14 months on Strensiq, my right humerus that was fractured and surgically fixed, but became a non-union, healed solidly. My arm was able to gain muscle tone, as did all my muscles. I didn't need to be on oxygen anymore, as now all of my ribs are visible. During a plating removal, my orthopedic commented that before Strensiq, he could push a thin wooden tool through my bone with his finger pressure, but now he cannot even use a metal pick to penetrate the outer part of the bone. So even though I still get hairline cracks from time to time, my quality of life and independent of life is vastly improved. As good as Strensiq is, there are many things of HPP it doesn't address. It helps the skeleton, but it doesn't improve the joint deterioration, nor the swelling and some of the pain. Strensiq is also a temperature-controlled drug, so it makes traveling with it very difficult. You have to make sure your ice packs stay frozen enough to pass through TSA, and that becomes a very hard challenge, mostly on the way home from your vacations. The one thing I would like to see changed is the frequency of taking the injections. 6 days a week is working for my body, but it is very inconvenient socially. I self-inject all my injections, and I have to make sure I have time in the evening to include these shots at least 2 hours prior before going to bed. Also, I have rotated injection sites, like it says in the pamphlet, over my entire body for 7 years, and it has left its marks of lipodystrophy in these areas, to the point where wearing summer clothes, exposing my arms and legs can cause me a lot of embarrassment. I'm looking forward for the possibility of having a treatment that treats more of the symptoms of hypophosphatasia. Because HPP is more than losing teeth when you are a toddler and fracturing throughout your life. As an adult, the degenerative joint disease and stenosis of the spine and skull are a large concern that leads to immobility that has not been addressed yet. I would hope one day that the doctors would have a choice to treat patients' wide range of severities and symptoms, as we are all different and need choices of treatments to help us with our HPP challenge throughout our lifetime. Thank you very much.
My name's Sally, and I live in Texas with my husband and my son, Nick. I was told as a young child that I was very, very rare. Indeed, I was being 1 in 100,000 having HPP. And I thought I was an only child until one day I was going through my mom's dresser drawer and found this darling pair of Mexican baby shoes. And I thought they were mine, but my mom broke down and told me that they had been my older sister's baby shoes and that she had died in the early 50s. And she also had HPP, but also had been diagnosed with rickets. And she'd been given massive amounts of vitamin D, and that's what ultimately led to her death. And Patty was very, very fragile. As a child, I tried horseback riding, roller skating, anything. I was adventuresome. I did it all. And I think that was great. I had a normal childhood. I did have multiple fractures, but they actually didn't start until 1976 when I was in college. And then in 1982, I had a car accident that was pretty severe. But since then, I can't tell you how many metatarsal, tibia, fibula, elbow, shoulder fractures I've had. I did try one drug, but in the end, it didn't change anything. My doctors, I've had many, would always get little tears in their eyes and be like, oh no, not again. We got another fracture we have to deal with. And they get all sad. And they just didn't know how to break it to me, but I already knew that I had another fracture. It was always hard. An 8th grade field trip to the East Coast with my son's trip basically put me into a tailspin for 15 years. And I'm just getting over that right now. Eventually, I was recommended to be on something called Strensiq for congenital hypophosphatasia. Had I not ever been told about it, I think I'd be in a long-term care facility because every bone in my body was breaking at that point. And I dose 4 times a week, and with that aspartame alpha enzyme, I tell you what, my bones turn over. My endocrinologist was thrilled. She'd take pictures of me getting out of a wheelchair, and I've not broken anything, and that's been almost 6 years ago now. And my quality of life's changed, and it's been fabulous. The only downside for me was that I got lipodystrophy, which is one of the side effects that can happen with Strensiq, which means that it was just kind of a disintegration of my stomach area, which is my main focal injection site area. And that caused me to have my whole stomach reconstructed, including belly button, everything, and lipo done. And I did also lose 70 pounds, and that was a good thing. And I got a flat tummy out of that. And so that was great. I was put onto a pyramid, 50 milligrams twice a day, and phentermine 37.5 milligrams, 1 tablet before breakfast. And then I'm on losartan blood pressure, but I have good blood pressure now because I lost that weight. I do have hydrocephalus, so I take Puracet, which is butalbital, acetaminophen, and caffeine. And that is with 50 milligrams, and acetaminophen has 325 milligrams in it, and caffeine has 40, and butalbital has 50. And that really helps with the pain. It does not control the hydrocephalus, but it does help with the pain. So no one wants to shunt me, so we just deal with that. PRE1 malformation in the back of the neck, we just watch it. I'm in physical therapy to get my core back right now, and I love massage therapy. I'm real careful with chiropractic care. As long as they don't use their hands, I'm good. Once in a while, I wake up in the middle of the night and there's a lot of itching, and it's a place where I injected, and it was a tougher area. Sometimes it's tougher to inject in. It feels like you are injecting into a brick wall. And that's one of the things that is really tough. Sometimes with Strensiq, you have easy days of injecting in, and other days it's tougher. And those are the nights that you itch a lot. And I would love down the road that they have an oral solution we have, or a pill we take, something like that would make it a little more palatable. But other than that, I'm grateful for it no matter how it comes. Down the road, gene therapy is coming, and I cannot wait. I will be first in line to get that. So thank you so much. Thanks for listening to my story.
Hello, my name is Candace Tegg. I'm 17 years old, and I was diagnosed with hypophosphatasia when I was 18 months old. As far back as I can remember, I've been dealing with HPP. When I was young, I couldn't walk until I was 5, and I remember wanting to walk in my school Halloween parade, but they had to pull me in a wagon. We got creative though and made it work. I participated in the clinical trial for Strensiq when I was 4 years old, and I'm still on therapy today. I've had bilateral knee and ankle surgeries to fix bone deformities in my legs. I've been in physical therapy my whole life, and I have special orthotics that I'm supposed to wear in my shoes, but I really can't stand them. I've also had 2 skull decompression surgeries to help me with my Chiari malformation. I can't walk for long distances or run because of pain in my legs, but the biggest challenge I have lately are my injection sites. Right now, I inject 5 times a week. It's a lot for me to handle, while I'm so grateful for my medication, since it's made me able to walk and have more stamina. I even am able to play golf on my golf team, but I'm running out of places to inject from all, 13 years of shots. My doctor has advised me to stop injecting my arms and stomach. The spots I inject look purple and bruised, and my stomach looks disfigured and abnormally swollen and never goes away. I'm currently only able to inject in my thighs and my backside, and my doctor doesn't know how much longer my thighs will hold up. I've also had episodes where I did my shots and I suddenly had a feeling like my throat was closing and I couldn't breathe. I thought I was dying. I had chills and the shakes for 30 minutes after my injection and never really found out why that happened. It happened again over a year later and it was really scary. I have talked to other patients who had the same thing, and it scares me that no one really understands how or why that is happening. No one can tell me how to prevent it from happening again in the future, and now that I'm getting ready to go to college, I'm afraid of it happening when I'm on my own. Well, then what would I do? If I'm being honest, I'm worried about my future. I worry about having another reaction every time I inject, and then I worry that if I run out of places to inject my medicine, how will I be able to continue walking or even playing golf? I'm also worried what will happen to my bones. I hope that researchers will not give up on HPP, and my mom keeps telling me they're working on a cure, and that is what keeps me going and gives me hope. Thank you for listening.
Well, thank you, Cannon, to all of our panelists this afternoon for sharing not only your HPP journeys, but your journeys trying and exploring different treatment approaches, sometimes even clinical trials, really lots of different things to try to make life with HPP a little easier. So thank you for getting us started. Now it's our second opportunity to broaden that discussion and bring all of you that are live in our audience today, living with HPP and family members and caregivers, people living with HPP, into the dialogue to understand your current treatment experiences. So to get us started and get a sense of the experiences of those in our audience, we're going to kick things off with a couple of polling questions. So if you were with us this morning, you can go back to that same webpage. If you've just joined us, for our patients and caregivers, please open a tab on your browser on your computer. You can also open a browser on your phone. Go to www.polev.com/HPP PFDD. Again, that's polev.com/HPP PFDD. Keep that page open throughout the remainder of this afternoon session. We'll be going to different polling questions periodically, and they'll automatically appear there. So our first question for everyone this afternoon is, we'd like to know, what medications or medical treatments have you or your loved one either used or have used either currently or previously to treat the symptoms associated with hypophosphatasia? And select all that apply. The options include pain medications, both OTC, over-the-counter, and prescription; B, enzyme replacement therapy, or ERT; C, calcitonin; D, sleep medications; E, antidepressants or anti-anxiety medications; F, dietary supplements like vitamin B6, vitamin D, and multivitamins; G, surgery, orthopedic surgeries like rodding and plate surgeries; H, if you've not used any medications recently; or I, other medications or medical treatments that you or your loved one have used either currently or previously to treat the symptoms associated with hypophosphatasia. As a reminder, this is our first question this afternoon. We're seeing our audience is able to select more than one response. So the percentages we're seeing are not a percentage of people that are selecting any one response option, but think of these bars as kind of a relative ranking based off of the amount of responses that we see. So as it stands, some of the most commonly used medications and medical treatments reported by our audience today include pain medications, both over-the-counter and prescription, as well as enzyme replacement therapy. After that, we're seeing different supplements, dietary supplements, as maybe a second tier, followed closely by antidepressants and anti-anxiety medications, surgeries, and sleep medications, as well as other medical treatments that we don't have listed here. We do see some experience with calcitonin, and a smaller amount of people reporting that they have not used medications recently. So broadening to beyond just medications and medical treatments, we're going to go to our second polling question. And we want to hear about, of course, we do want to hear about those medications, but beyond that, we want to also hear from you about what have you and your loved one used to help manage the symptoms of hypophosphatasia besides those things. And here you, again, can select all that apply. The options are A, physical therapy, B, occupational therapy, C, dietary changes, D, leg braces and orthopedic devices, E, canes or walkers, F, regular dental care, G, acupuncture, H, counseling or psychotherapy, I, some other type of management, non-medical management approach for the symptoms of hypophosphatasia that's not listed in another option, or J, if you are not doing anything or your loved one is not doing anything to help manage the symptoms of HPP. So while results continue to trickle in here, we're seeing perhaps the top two most common management approaches being physical therapy as well as regular dental care. After that, we're seeing dietary changes, leg braces and orthopedic devices, even canes and walkers and occupational therapy, as well as other things, being more commonly reported. We do see that people are using acupuncture and counseling as well. And again, a very small number reporting that they're not currently doing anything to manage the symptoms of hypophosphatasia. One more polling question here, thinking, if we go to our next polling question, thinking about everything that we just covered, medical, and kind of not traditional medical together, how well does all of that help you or your loved one treat the most significant symptoms of hypophosphatasia? The options are A, not at all, B, very little, C, somewhat, D, to a great extent, or E, if not using anything. I promised these questions were going to get harder as the day went on, and I think this represents one of those, trying to think, how you would report that whole treatment regimen, helping treat those most significant symptoms. As you're making your selection, I want you to think about what is really driving, this, because this is a subjective, kind of question. So what's come to mind? What is really making you, for the around 50% of people are saying somewhat? What is that somewhat? What was left? Why didn't, what was the difference between selecting that and to a great extent in your mind? For, around the 25% that, said to a great extent or very little, same thing. We want to know, what was your benchmark? What led you? What treatments, have led to those outcomes for you? And for the less than 5% that said not at all, again, what treatments are you talking about? And what was your were your treatment goals going in that were not achieved? We do not see anyone reporting here that they're not using anything, medical, non-medical combined. So keep that in mind, and if you'd like to share your experiences with current treatments, at this point I'd like to encourage you to call in to share that. You can dial in throughout this session at 1-703-844-3231. Again, that phone number where you can dial in. You'll talk to one of our operators. They can get you into our queue so we can bring you into the discussion. Dial in at 1-703-844-3231. Also mentioned you can write in throughout the session using the comment box that's under the live stream on the webpage that you're on today. But while people are calling in and writing in with some of their responses and thoughts, I'd like to welcome our Zoom panel, some of your peers who are here, and we'll be sharing your experiences as well. So I'd like to maybe start the discussion today thinking about those different treatment approaches with the things that you've noticed that have been most helpful. You know, whether that's something that's helped a lot or just a little, we want to hear about what that might be. And so, Pat, maybe we can start with you, thinking about that again, of all the different things that maybe you've tried or are currently employing, what has been most helpful?
So, hi, I'm Pat. I'm from Westchester County, New York. I wasn't diagnosed until I was in my 50s. However, I have been symptomatic since I was an adolescent. Primarily bone pain, joints, tendon abnormalities, terrible teeth, stiffness. I have been treated with Forteo, but that did not have any benefit at all in terms of any of those symptoms I just described. I have not yet been approved for enzyme replacement therapy. I do use meloxicam, which is a prescription nonsteroidal medication. I have had courses of corticosteroids, both orally as well as injected into my joints. Physical therapy, occupational therapy has been tremendously helpful. I have a lot of balance issues, and so I work out with a trainer, and I must do some sort of exercise and stretching every day, which is tremendously helpful. I can't over-exercise because then it puts me back for a few days, but definitely exercising daily helps. I've had orthopedic devices, boots for fractures, several spontaneous metatarsal fractures. I wear orthotics in my shoes, which also help tremendously. And I think it's important to have a good care team. So I have a rheumatologist, I have an orthopedist, and a bone endocrinologist that help to coordinate all of my care.
Yeah. Well, thank you for sharing the range of different things that you've tried and are currently employing. You mentioned that PT and OT have been some of the things that have helped the most, and that regular exercise is helpful. I think you were describing that helps in particular with maybe balance and mobility. Could you describe to us, how do you notice or kind of know in your own daily life that those things are helpful to you? Is there something specific that you can pinpoint and maybe share with us?
Right. When I wake up every morning, I'm very stiff in my hands and in my legs, especially my knees. I have had a knee replacement at an early age, but I force myself to do some kind of exercise, usually about 45 minutes a day, either walking or using a recumbent bike. And surprisingly to me, after doing that, I'm much better. And it reduces my need for medication. There are some days where I still have to take the meloxicam, but in general, it has a very beneficial effect. Also, massage and heat application, moist heat.
And when you
yes, go ahead.
Yeah. I just want to, make sure I understand when you say, it's been a really beneficial effect for you. Is that in terms of just the pain you're feeling? Is that making you, physically, are you able to, be more active or do certain, kind of activities, those days? Just kind of what are those benefits look like?
The stiffness goes away for sure, but it also does help the pain in my joints, which seems paradoxical, but it's true. The pain actually is alleviated by doing that. If I do too much exercise, then I'm extremely fatigued, and it has a negative effect.
Okay. Yeah, well, thank you
But
for
yes,
helping
it
me
improves mobility and perhaps the balance. I do walk with a cane. Or I use, when I'm walking, I can use the trekking poles, which also help.
Right. Well, thank you so much, Pat. Chris, I'd like to bring you into this discussion as we're thinking of maybe the things that have been most helpful. What comes to mind for you? Oh, Chris, you're on mute.
Sorry about that. Thanks for having me. My name is Chris. I live in Brooklyn. I was diagnosed in my late 30s as my symptoms began to materialize. although I did have some early childhood symptoms as well, largely through a deformity in my left foot and left tibia. I've been on Strensiq for 5 years. I have an 8-year-old boy who also has HPP but is not showing any symptoms currently.
Okay.
My primary symptoms are severe osteoporosis, joint pain, some endurance limitations, and I also wear orthotics, as well as a 1-inch lift in my sole of all my shoes due to my tibia being a bit short on my left side. But in terms of treatments, to answer your question, I also agree. Staying physically fit as much as I can be has been really, really helpful. I feel the similar effect as Pat. If I'm stiff or I have joint pain, the musculoskeletal weakness that can come with having disease like this and feeling like you're limited, your mobility or your endurance is limited. I try to really maintain as much physical activity as I can to maintain muscle strength, to support my skeletal issues. I felt like has been a huge help to me. Strensiq as well, I like to think is helping. It's always hard to measure the efficacy of Strensiq over a longer term period, but I'm glad and happy that I'm on it.
Sure. So Chris, kind of along the same lines as Pat, I'm very curious. When you talk about some of the benefits that you've had from physical activity and physical therapy, for you, what does that look like? Do you notice something, when you're have that routine and on those days where you do have PT, or maybe is it more over the long term? But just very interested on what your kind of personal kind of benchmarks are.
Yeah, I've always been very physically active, and I've been fortunate enough to not have yet ended up in a period where Strensiq has severely limited my endurance, although I do feel it. And as I get older, I feel like I'm struggling a little bit more. I'm someone who enjoys hiking mountains and can still do that, right? I can go to New Hampshire, Maine, or Utah and hike a Rocky. But I do it with some pain. I do it with some post-day pain in my ankles, a lot of hip joint pain. I've worn away all the cartilage in my hips because I have a slightly shorter left leg, so I rotate in an odd fashion. And so I feel that. I fight it. I want to maintain my activity. I fear that I will lose my activity if I don't fight against that and push myself as much as I would. But I think it was Pat who said, what I've learned is, as I like to ride bicycles. I can't run. Any hard impact on the feet or the ankles is too much to take, but walking up a mountain is fine. Riding a bicycle is fine. What I fear, though, is that the balance. If I overdo it, I suffer for several days at least, if not several weeks thereafter. I don't recover as quickly as somebody else would. The wear and tear is harder on me. And so balancing to be as active and as physically fit as I can be, because I know that's good for me against this disorder, is very tough to balance, because you wanna push yourself and you wanna stay strong, but you can overdo it fairly easily.
Right. And then that's very helpful, Chris. And then on the point about Strensiq that you made, you said that it's kind of hard to tell if or how it's helping you over the long term. Can you tell us a little bit about what your decision making is, to continue taking a drug that you said you're very happy to be on, when there's some unknown or uncertainty about the benefits that it's having?
Sure. I was fortunate enough in New York City to have a lot of progressive doctors who were very quick, almost as quickly as I was diagnosed, to tell me to get on Strensiq, and were happy to sponsor that. I spent some time thinking about that because it was a lot to take in, but my bone density is really not great. I have severe osteoporosis, way beyond my years by decades and decades, and that was what drove me, because this is a progressive disease, and I'm only in my early 40s, and if it's what it is now, I need to do everything I can to try to stave off continued progression.
I see.
And it's tough to balance how that's helping me. My bone density scores, which are not a great way of measuring the efficacy, are starting to flatten out, but they're not getting any better. But maybe that's the right story. Maybe they're not getting worse, and that's what I need to believe in, as opposed to flatlining, right?
Sure.
The ideal would be improvement in those scores. Maybe that just takes a little more time.
No, Chris, what you said is really insightful. It helps me understand that it's not just about improving, but also slowing and stopping the progression itself is an important treatment goal. You don't obviously see that day to day, but still knowing that that's an important goal of yours is very important to hear. So really appreciate that. Kate and Morgan, want to bring you into this conversation as well. We're trying to understand the range of treatment approaches that you've tried or are currently using, and kind of starting here with this discussion of what maybe has been most helpful.
Hi, my name is Morgan. I'm 17. I'm from Carlsbad, California, and I was diagnosed with HPP when I was in utero. And
good morning. I'm Kate. It is morning here. Morgan was diagnosed in utero. She broke all of her long bones in utero, and we were told to terminate the pregnancy because she would not have a quality of life, which we chose not to do. And thank goodness, because this little darling is here, and she's a force to be reckoned with. But what we did, Morgan, we did physical therapy right off the bat. She did horseback riding. She swims. She rides a bike. She needs to be more active. I tell her that every day. But we started with the clinical trials when she was 4. So she's been on Strensiq now for 12 years. And she's doing really well. We do have injection site issues, skin breakdown, things like that. But because she started so soon, I think it really did help with building of bone and making her, she had walkers and wheelchairs and orthotics, and she does have shoe inserts, but she hates them.
I don't like
she won't wear them. But we do physical therapy. We try to get her out in the sunshine quite a bit.
We go walk on the beach.
We walk on the beach. She has a therapy dog. So she does have some balance issues, which is where the dog comes into play. She's a 100-pound chocolate lab that sort of gives her some stability. So,
that's great.
we just, it's a day-to-day thing. That's one of Morgan's favorite words, is just to live for today.
One day at a time.
One day at a time.
Oh, well, thank you for sharing all of that. I do want to follow up. You mentioned that, when Morgan, when you were younger, you had to rely on, canes, walkers, wheelchairs. Some of the things that, kind of PT, staying active, and of course also Strensiq, kind of together, have they helped with any of those things at all, or are those still things that you rely on regularly?
So I don't use walkers anymore. I haven't since I was like 8.
Okay.
And so I think that Strensiq, it definitely over time, it helped me so much that now I can go out and do things, and so with some normalcy. I mean, I can't run or anything, and I can't do like volleyball, but I can do stuff that it's still getting out and getting active and doing things. So yeah.
What's, Morgan, something that you like to do that you are able to do, because of some of that benefit?
I like to swim. I ride horses, take my dogs for a walk, go to the beach, swim in the ocean, all the fun stuff.
Yeah.
She just got an electric bike too, so she gets out and rides her bike, which is never ride a normal bike again.
That's fantastic. Well, thank you both so much for sharing that. Do want to bring a caller into the discussion. We have Tracy from Arizona who wants to share maybe a few different things that she's tried that have been helpful, including some more holistic things that we haven't heard so much about, like massage therapy and chiropractic visits. So I'd like to welcome Tracy into the program. Are you with us?
Yes, I am.
Welcome.
Hi. Well, I'm 64 years old, and I did HPP for 57 years, so it feels wonderful to be a part of a community because it was a very lonely experience at the beginning. What I'd like to talk about is my muscle involvement.
Okay.
I have an idea that I have too much contraction for not enough action. And I no longer walk because of metatarsal fractures in my feet and poor balance and fear of falling. So my tendons and ligaments have become so stiff and bone-like. They like snap, crackle, and pop and tear and stretch. So I know the muscles are trying to compensate for the brittle, weak bones. And that's what I would like to see treatment address.
Okay.
So massage therapy has been crucial. I have a therapist that comes to my home once a week,
Okay.
and we just work on my legs and my feet because the rest of my body I'm very sensitive. I see a network chiropractor twice a month.
Okay.
I visit naturopaths so we can discuss different dietary and supplement changes.
Sure.
And when we put the Strensic on the bioscan machine, it came up 100% applicable to me. So that made me feel really good because the Strensic, see, I was at the position where I could know my body had forgot how to cough. I couldn't sneeze. I couldn't laugh anymore because I was afraid of imploding and breaking from within. I had to spend most of my days before Strensic in a recliner. And I, just like everybody else, am a very active person. So that was just really breaking my spirit.
I see.
So I know that Strensic has been extremely beneficial, but I also take magnesium. And I learned that there's many different types of magnesium. So the conquest of always educating myself to, yes, I do vitamin D. No, I stopped the B. And whether to do it or not has always been a question. So there's so many different ways to address it. Modifying my home. You know, if we look at the entryway, we had to add ramps. We had to adjust my bathroom. I have a shower chair, raised toilet, and grab bars because the fear of falling is real. And that has helped me to remain independent, which is one of my goals. I want to be able to take care of my personal care. I've had to give up driving. That was really hard. But with all the medication that I take and the lack of sensation that my feet feel, I didn't feel that it was appropriate for me to get behind the wheel anymore. It's just really difficult to maintain friendships because if somebody wants me to plan to come over next week, I don't know how I'm going to feel. And so I've had to let all my close friends know, please don't take it personal if I say, I'm sorry, I have to cancel or reschedule.
Sure.
And fortunately, my medical team also realizes that I may miss an appointment, and it's really not in my control. And that's one of the most difficult things about HPP is I don't really understand what causes the pain or why I didn't sleep well last night. And, you know, that mystery is so baffling that it makes me cry.
Yeah.
So I just want to say thank you to everyone for the research, and I just appreciate and love everybody.
Yeah. Well, Tracy, thank you so much for calling in and sharing that range of different things that you try. We did hear so much this morning about the uncertainty that comes with living with HPP, and so kind of this multi-pronged approach to treatment. I think it's a theme we're starting to hear, and Appreciate you also describing some of the modifications to the home environment and that have had to be made to help prevent falls and the like. So thank you so much. I know that we've also been getting a number of written comments coming in on things that have been helpful. So Deborah, what are we seeing there?
Yeah, Judith from Melrose, Massachusetts says, Strensiq has helped tremendously with musculoskeletal weakness and fatigue. After experimentation, musculoskeletal pain is kept under control by a combination of different medications. Sandy from Campbellsport, Wisconsin says, I'm starting to move up and down steps easier after being on Strensiq for 6 months. Hydroxychloroquine helps with inflammation, Tylenol, and celecoxib for pain. Jessica from Wausau, Wisconsin, our daughter was started on Strensiq at 2 days old. If it weren't for this medication, she would not be with us. Then Abby from Ossining, New York, I have taken all of the standard anti-inflammatories. Now I take meloxicam and Plaquenil, both which are probably helpful, but not enough to let me do more. I'm also now taking gabapentin, but the lowest dose with rather limited efficacy. Also currently in PT for gait and balance issues to improve mobility and stability. And then Catherine from Aldi, Virginia says, I started Cymbalta. It has helped lower my pain level. I can gently jog now. And then on the holistic side of things, yes. Melanie from the UK says, I've paid privately for osteopathy, podiatrists, physiotherapists, acupuncture, Reiki, Bowen technique, aromatherapy, massage, mindfulness course, hydrotherapy, and shockwave therapy. At least by visiting alternative options, you can try to keep hopeful and focused.
Yeah, that's fantastic to hear those experiences, and really appreciate, again, everyone who's been writing in. You can continue to write in throughout the program, and we'll continue to read your quotes using that comment box that's under the live stream here today. I do want to broaden the discussion, though. We've been focusing on and heard a lot now of different things that have been most helpful, but we know that there'll be treatment experiences that either maybe haven't been as helpful, or whether or not they have been helpful might come with some downsides or drawbacks. And so particularly on those drawbacks, we'd like to get a sense of what our audience has experienced, and we'll ask you to participate in another polling question. So go ahead and pull out that phone, go to that web browser on your phone or on your computer, go to pollev.com/HPPPFDD. Here we want to know what are the biggest drawbacks of your and your loved one's current therapy. Just hold on 1 second, we'll get that polling question up for you there. Here we go. And so here we want you to select up to the top 3. So the options are A, not very effective at treating the target symptom or symptoms. B, the therapy only treats some but not all of the symptoms. C, the high cost or copay, or the fact that it's not covered by insurance. D, that it's of limited availability or accessibility to you. E, lipodystrophy. F, anaphylaxis reactions. G, allergic reactions. H, the burden of the injection regimen. I, injection pain. J, the development of antibodies. K, that it's too much effort or time commitment to keep up with the treatment regimen. Or L, some other drawback that you view as one of the biggest drawbacks of your current treatment approaches. Or M, you can select if you're not using any treatments. So again, we want to know what are the top 3 biggest drawbacks of that range of different treatments that you have available to you now. And as it stands, it looks like the top one is that they treat just some, but not all of the symptoms. After that, we see a few things, kind of a second tier. We see both the high cost and copay, as well as the burden of injection site regimens, as well as lipodystrophy, kind of all rising up as together. But then we see, each and everything here listed in some number of people's top 3 biggest drawbacks. And so what I'd like for you to do now at this point is, share with us, what have you tried, and how do these drawbacks, whichever of these you experience, how do they impact your daily life? or maybe if you think about it differently, maybe if these are some things that could be avoided, what would that mean? How would that improve your life, to not have to live through or deal with one of these drawbacks? So I'd like to encourage you to call in if you'd like to share some of your treatment experiences. You can call in at 1-703-844-3231. Again, that phone number is 1-703-844-3231. We'd love to have you share your treatment experiences. But now I'd like to come back to our Zoom panel and start the discussion, perhaps with Elizabeth. If you're thinking about treatment experiences, is there something you've tried that maybe hasn't been as helpful, or even if it has been helpful, has come with some trade-off or drawback, like something listed on in that polling question?
Sure. Hi, my name is Elizabeth, and I am from Brooklyn, New York. I am a caregiver for my son, my 2-year-old son, who has hypophosphatasia. He is a twin, and I was able to identify the differences between him and his brother early on from 2 to 3 months. And he was eventually diagnosed at 5 months with failure to thrive and low weight gain. And he started Strensiq at 6 months. One of the things that I've noticed, which was not listed here, is his fear. He is very fearful. As soon as he sees the orange cap needle, he starts crying, because he knows he's going to get his injection. And another thing, so what we have done to help alleviate his fear, we've tried introducing a toy that he's never haven't seen before and reward him with it. Or we've tried stickers because he likes like lion stickers or animals, to try to reward him with a sticker. And that helps, but he still is fearful of the needle. He has experienced the lipodystrophy, and we have had to reduce the amount of times he get the injection. So he started off at 6 times a week, and now he gets it 3 times a week. And though it is helpful, we do try to rotate locations on where he receives the medication.
Right.
Unfortunately, we couldn't use the abdomen because he had a G tube placed in, so we had to rotate between other sites more frequently.
Okay.
But that has been, affecting his life more so because of the fear, and also feeling, I'm assuming is feeling pain, as I've spoken to other people who are older and can tell me how it feels like. It feels like a burning sensation when it goes in. So I could imagine why he is so fearful.
Mm-hmm. Sure. No, that's really helpful. And of course, I think that fear and maybe, kind of anxiety that he's experiencing, seeing the cap and the needle, that is real. And so, certainly is a real downside for us to hear about. The lipodystrophy, can you maybe tell us about how long it took, until, from starting on drug until, that was identified, and, just kind of a little bit about that experience?
Yeah, maybe a couple of months in. I would say about 6 months in, when we started noticing the texture of his skin was changing. And it was like very leathery, especially where he had low muscle mass behind his arms. That one was a prime area where we would eject him. Um, and that's where we noticed it. So about 6 months in. So we started using his rear and also his thighs more frequently.
I see. And, you mentioned that you did have to reduce the frequency of dosing, but it sounds like even with that side effect, that's something that you're willing to tolerate in exchange for the, benefits of staying on the product.
Correct. And also, the less frequency helps both of us because honestly, as he gets older, the bear hugs are a little bit harder to hold him down to administer the medication. When he was a baby, it was easier, but now he is fighting us each time when we go to administer the medication.
I see.
So less frequent during the week is much better for on both ends.
Okay. Yeah, well, that's very helpful to hear. Thank you so much, Elizabeth. Cindy, would like to bring you into this discussion as well, exploring some of the things that maybe haven't been as helpful, or maybe even if they have come with some downside.
Hello, I'm Cindy. I'm from Southern Indiana. I'm a patient. I also have 2 adult daughters with HPP and 2 granddaughters with HPP. And so, enzyme replacement, let me start with, it's been life-changing for me, but it does have its downsides, of course.
Okay.
I'm one that has a lot of the lipodystrophy. I'm running out of injection sites. I also started on the trial, so I've been on it for a while now.
Okay.
We actually did the opposite with mine. We thought I was having some absorption issues because of lipodystrophy, so we doubled my dose. So I'm shoving in more Strinzig into those fatty areas, trying to get more to absorb in. And we kind of compromised them down to 1.5 times the dose now, and feel better from that standpoint. Physical therapy is something my doctor keeps an open order for. Anytime I feel like I need physical therapy, I can go, but I live very rural. So getting out and going is a whole ordeal. It's an hour there, it's an hour back, and we're coming into winter, which I need to go, but do I want to be out walking on the ice and the snow? I love warm water therapy, but that's another thing in the winter. You go in there and you get so nice and warm and toasty. And then when you get out of the pool, your body feels like it weighs 300 pounds because your joints had all that relief and stuff while you were in that water. And then, of course, you're wet and cold when you go back outside in our nice Midwest winter weather.
Yes.
Then for my granddaughter, when she was younger, shots were good doing the bear hug, but as Strinzig got her stronger and feeling better, they can't even hold her down. So she had to go off of injections because they were afraid they were going to hurt her while trying to administer. So that's not been good.
And that was just from, the pain and
yes, the injections hurt very much going in. They burn like fire. And so being an adult, you can do it yourself. You can slow it down, breathe with it, like labor pains, that type of thing. But the little ones, you got to inject it so fast to get it over with before you lose your hold on them, or they pop the needle out because they're tensing up so much. They pop that needle out, and then you got to re-stick them.
Right. Sure. And then, for you, Cindy, you mentioned, that you do have some of the thickening of skin, and I think you said lipodystrophy. And so, again, that's something that, obviously you've increased also your dose of Strinzig to help kind of counter that. What is your thinking, decision making about, continuing that treatment and upping that treatment, while also experiencing, those side effects? Can you kind of just share, how you continue to, evaluate the decision to stay on and even, as you described it, increase the dose of that drug while also experiencing side effects?
So I never want to go back to where I was before Strinzig. I was pretty much bedridden, scooter bound. The neurologist couldn't believe I didn't have early onset dementia. He tested me 3 times, and I was just a brain fog and confusion, and I had auditory processing issues. They thought I was getting hard of hearing, but my hearing tests were fine. I just couldn't process what people were telling me. And so I never want to go back there again. And so until something better comes along, I don't ever want to be without my Strinzig.
Sure. No, that's very helpful. I see we are getting some written comments on some treatment experiences, maybe things that haven't helped or have side effects. So what are we seeing?
Jennifer from East Bridgewater, New Jersey says, my child started treatment at 6 years old. Our biggest struggle is giving her the injections and the impact of the active injections on our entire young family. I'm often the only adult in my household with my husband who frequently travels for work. I cannot administer treatment without 1 or 2 other adults holding her down. Emily from Philadelphia, says, I was on Strensiq for a year and a half, but my condition worsened significantly, and I developed many new symptoms consistent with an autoimmune disorder. I also lost significantly more bone while on Strensiq. I stopped taking Strensiq at that point. Stephen from Nebraska, several factors went into my decision to stop Strensiq. My labs indicated a decrease in efficacy, and my ALP levels went down over time. My biomarkers of bone turnover remained stagnant throughout treatment. Richard from Oakland, Michigan. My son developed injection site reactions even while rotating his sites. Injections were very painful. His stomach bulged with hard knots. His symptoms worsened, and his doctor believed that after the subsurface reactions had begun to limit his uptake of Strensiq, and after 3 years, my son and his doctor agreed it would be best to stop treatment.
Sure. Thank you for those that written input. Please keep that coming. Use that written comment box under the live stream that you have on your webpage today. I do see that we have a phone caller who wants to share some of her treatment experiences. We have Wendy from New York, who is a person living with HPP. So I'd like to welcome Wendy to the program. Wendy, are you with us?
Oh, hello.
Hello.
Yeah, it's very thankful for this this forum, this format, and this is probably the first time I've heard so much mention of the comorbidities. I'm, I guess, in that 50%. I don't have fragile bones. I have some, you know, I like to say out of factory spec joint formation. I also have hypermobile Ehlers-Danlos, along with autoimmune channelopathy, mast cell activation disorder, dysautonomia, confirmed small fiber neuropathy, but we have some heart rate and vascular to be determined activity going on. What else is in there? It's quite the confirmed and the to be confirmed, and you know, managing what's a symptom versus what is a reaction, and which Venn diagram bucket does it fall into? Is it an HPP, or is it a Ehlers-Danlos? Is it a dysautonomia or mast cell? And it's been a migration. I had very minor symptoms, backtracking into them in childhood, but highly functional and until my early 40s. And in 2017, you know, I went from hiking and kayaking and, you know, using power tools, building things around the house, remodeling projects, highly active in addition to my high-level finance job and leading a Toastmasters club from formation. So, you know, a rather dynamic lifestyle to suddenly my muscles weren't working and they were cramping up, and the only test results were showing non-detectable vitamin D and a low alkaline phosphatase, and this is 2017. So it wasn't, and you know, also I have the autoimmune aspect of it going on, so that was forefront. Unfortunately, early on, I was told I did not have Ehlers-Danlos, so that derailed my diagnosis path. I spent a lot of time with physical therapists and occupational therapists, and I was able to, you know, grab pieces here and there of, you know, what I can do on my own, because the physical therapist, while covered by insurance, would hurt me, or they would fire me because I didn't have an injury that I was recovering from. I had a chronic condition, and the more I was doing, my tendons and muscles would lock up and spasm, and now I couldn't do anything at all. So the more they tried to give me, the less I could physically do.
I see.
So, you know, I had to come up with my own Nordic pole walking when I can, aquatic therapy, and, you know.
And do you find that those are helpful to you in helping with any of those, you know, the different health concerns that you're living with?
As someone mentioned earlier on the panel, it is a balancing act because,
Okay.
you know, when my heart rate isn't acting properly from the dysautonomia,
Right.
it impacts my activity level of what I can physically, like, can I breathe long enough and am I getting lightheaded? But if I don't move, then the muscles and the tendons, you know, they start being unhappy. So it's that delicate balance of what is my body going to let me do? I don't want to decondition any further.
I see.
But if I push myself too hard trying to build endurance, now I'm going to fatigue
Right.
and have a setback. It's an amazing balancing act, and unfortunately, too many of the professionals in the physical therapy realm are for injury recovery. I'm fairly confident in my understanding, and I utilize resources online for
Okay.
exercising. You know, a lot of the myopathies organizations have helpful tips on exercises when your muscles don't work right.
Right.
But, you know, thinking back over the progression of this, you know, I started using compression because of vascular and muscle fatigue, and then bracing for muscles quit working. I'm hypermobile. I need braces to stand upright.
Right.
And minimize the fatigue so my muscles aren't working so hard to keep my joints in place.
Sure.
So learning how to do things in different ways, like someone else mentioned on the panel, what used to take me 30 minutes, it might be a week before I can actually get that task done. And if I choose one task, you know, is it something I want to do, or do I attack my to-do list of these things I have to do?
Sure.
And if I use my energy on that, you know, or fatigue trying to do one of those, I'm not immune, or I'm appreciative of I'm fortunate enough to be able to see a lot of specialists with for my conditions,
Right.
but they no longer want to participate with insurance. So I'm having to pick and choose, you know, which avenue do I want to go down that I can afford to pay out of pocket. You know, I do high dose IVIG since 2019. That's 3 days. If my veins cooperate, that's 8 hours a day plus. Thankfully, the nurse comes to me. That's every 3 weeks for 3 days, all day long, and it triggers my mast cell reactions. And then everything else I take Dupixent to help with some of those reactions. Strensiq for me is 3 times a week, and I can't do it at the same time as my IG. But if I go more than 4 days in between Strensiq, then my muscles and joints start locking up. So I have to manage my reactions to the treatments that are making me functional or more functional. But I'm far from being, you know, I don't think there's going back. It's like where I am right now, and how can I improve that? How can I figure out ways to do the most I can? Because I don't know what it's going to be from one moment to the next. And that's incredibly hard to explain to people, doctors, family, friends, and yourself. Like, well, I did this one thing before and I did it successfully. That doesn't mean I'm going to be able to do it again in the same way I did it before. I never know how much I'm going to have to work with.
Right.
So I have, you know, it's such a balancing act between symptoms, reactions, condition, you know, what medical avenues do I want to pursue?
Right.
What can I afford to do physically, mentally, financially? You know, there's so many things that have helped, but, you know, compression has helped. Did you know that your brain receives the compression sensation before it receives the pain sensation? So it doesn't have to be extremely restrictive, but if your body can feel the compression, it will, in a way, override the pain to a degree. It might bring it from our lovely pain scale of 8 to a manageable, you know, 6.
I see.
but
Sure.
it's something. Pain is an interesting thing. I have pain. It's significant, but pain is not my problem. Does it impact my day? Constantly, every day, to some varying degree.
Yes.
I'm afraid to pursue pain management by way of pain pills because I don't want to stress my kidney and liver because I need to be able to take Strensiq and I need to be able to continue my IVIG as long as insurance covers it.
Right.
And that's another whole topic. So I
Yeah,
pay out
well,
of pocket for a whole bunch of really excellent doctors,
right.
but there's, I'm afraid to discuss or appeal anything with my insurance company or even take full access of what they will cover because they are paying for Strensiq
Yeah.
and they
Well,
are
Wendy,
paying for IVIG.
this
So
is
when they don't want to pay for my psychologist appointment, I'm afraid to pursue that with them.
Yeah. Well, thank you so.
Okay, your turn.
Yeah. No, this has been really helpful, Wendy, and I think there's so many things both that you're balancing and juggling both on the different comorbidities and then this kind of trial and error and having to balance the disease against the complications of all of the different treatments. It's I think you really helped us understand that interplay. So really appreciate you being willing to share so much of your personal journey with us. I do want to check in with our Zoom panel and see, with a little wave of a hand, is there anyone who's maybe had experience with a treatment approach we haven't heard much about yet, whether that's something that's helped or maybe hasn't helped with, would be interested to see if there's something that maybe we've missed or haven't fully explored. Yeah, Pat.
I just wanted to mention the dental issues. We haven't really talked about that. When I was growing up, every time I went to the dentist, I'd have 16 cavities, and they thought it was because I was eating too much candy, and my teeth would crack and all of that. So I think it's really important that you have close dental follow-up. I've had lots of crowns and root canals and implants, and so I go to the dentist 6 times a year just to have everything checked. But that's another aspect of the disease.
Absolutely. Yes, and we heard a lot about the dental issues this morning, so thank you for addressing that. Of course, that needs care and attention as well. Anything else from our Zoom panel? If not, I know that we have gotten some written comments in during the course of this session since we last heard. So Deborah, would love to hear more about that.
Yeah, some interesting conversation here. Debbie from Los Angeles says traveling with Strensiq can be quite a challenge because of its refrigeration requirements. And then Rebecca from Colorado says that her daughter receives 12 injections a week, Strensiq and growth hormone. She has lipoatrophy on both arms. Her legs and buttocks are bruised. We're running out of shot sites. As she nears the age of a teenager, I worry about those discolored and lipoatrophy areas will impact her already fragile self-confidence. So mental health concerns as well.
Yes. Well, thank you for everyone for helping us understand the range of current treatment approaches. It sounds like, and we've learned that there are many things that have helped, but there's still a great deal that's needed, and there's certainly some trade-offs that you all are living with in exchange for some of the benefits of existing treatments. But I do want to make sure that we spend some time today looking towards the future and thinking about what might come next and what you all would like to see from future treatments. So with that, we're going to go to our last polling question of the day. If you can go ahead and go to pollev.com/HPP-PFDD. Here we want to know, short of a complete cure for your or your loved one's HPP, what specific things would you look for in an ideal treatment for the condition? And you can select up to the top 3 things that you're looking for in that future treatment. So here the options are A, help with sleep, B, easy administration, C, fewer no side effects, D, help with brain fog, E, increased ability to walk, F, improvement in balance, G, reduced pain, H, prevent bone fractures, I, improves dental problems, J, slows or stops the disease progression, Or K, some other specific thing that you would look for in an ideal treatment that's short of that complete cure for hypophosphatasia that you would identify as a top 3 priority for that future treatment. So I know this is difficult to only pick 3 of these things, so we'll give you just a few more moments to think about and make your selections. But as you're making your selections, I do want you to think about how did you narrow this down to just those 3 that you selected. We really want to hear from you about your priorities and preferences for future treatments. That'll help us as we the collective think about how to develop new drugs and make sure that treatments are addressing the needs that you have. So as it stands, it looks like the top need or specific thing that this community is looking for is something that will help slow or stop the disease progression. Number 2 would be reduce the pain. After that, we're seeing kind of a cluster of things that include, ease of administration, fewer side effects, helping with brain fog, and increasing the ability to walk. But again, we see every single one of these things being asked for as a top 3 priority for members of this community. Nothing on here has not been selected as something that is really, really important for some number of you. And so again, we really want to hear from you. We want to know what if you had something that could do some number of these things, what that would mean for you in your life, and just generally why you made the selections that you did. So if you'd like to share some of your perspectives on what you'd like to see in a future treatment, this will be your last time opportunity to call in today. Its phone number one last time is 1-703-844-3231. Again, you can call in, share your perspectives, your thoughts on what you would like to see from a future treatment at 1-703-844-3231. And of course, you can also write in using that comment box under the live stream on the webpage today. But we'll start this off with our panel here on Zoom. And perhaps Kate and Morgan, we can start with you as you're looking at that list. I know it was hard to narrow it down, but what represents something that would be a top priority for a future treatment for you?
So for a long time, I've been asking for less injections and maybe once a year or twice a month, kind of something that an IV infusion or something that I could not have it every week, but have a longer period of time in between.
Okay.
And I don't know if it's something in the future that could be possible, but I really hope for it one day.
Yeah.
And something that would I wouldn't have to do it every other day.
Absolutely. Well, that's why we're asking the question, because most things are possible, and hopefully of course we'll get to a cure, but even things short of that, we want to know. And so I think this is a really good one, Morgan. And if it's okay, I'd like to ask you, what was driving that decision? Is it the discomfort of the injection, so having it less frequently would help have you experience that less frequently, that kind of the pain that we've heard described? Or is it there are other aspects of having to do this your injection so frequently that is informing your hope for something that can be administered once a month, once a year, whatever that may be?
So I think that if it was less frequent, I would let my skin heal a little, and then in between I could maybe, right now I have that, the skin breakdown of all of my shots in between. So
Yeah.
if I had more time to heal in the middle, then I would be in less pain and have less bruises and everything.
I think too for Morgan, I know that the one caller was talking about their teenager who self-esteem and you're already kind of walking funny and you are vertically challenged, and there are a lot of things that especially young teenagers, we when we were doing injections in the arms and her legs, if she got cold, she literally would have these huge purple bruises. And we've actually had teachers approach Morgan and ask that, are you okay? So we kind of have to hide those injection sites. So a lot of times it is on her backside. And it is that rotation site. So we don't do the arms and we don't do the legs or the stomach anymore.
Mm-hmm. Sure. And then, Kate, as yourself, as you were thinking about that question, is there anything you would add to the wish list for a future treatment?
Definitely less injections. I do question about the level of alkaline phosphorus as well, because a normal alk phos for people that don't have HPP tends to be in the 100 to 150 range. So a lot of times, when we do blood work for her, she's in the 7,000 range. And so I do wonder about that, whether we can kind of lower the dosage or have less frequent so that she stays in more of 1,000 range.
Okay.
That would be, definitely something that I would like to see happen, that we could get the range of the alk phosphorus more in a normal range.
Okay. Yeah. Well, thank you both so much for such thoughtful responses to that. Chris, how about you? Thinking about, what might represent, a feature of an ideal future treatment, what would you prioritize?
I am sympathetic and agree with the frequency of dosages. I take 2 doses 3 times a week, total of 6 injections. It never gets easy. It's always just tough to do. So having a drug with enhanced administration, meaning something that requires less frequency of dosage, something that isn't necessarily required to be kept at such a specific temperature. I travel for work. I like to go on family vacations, sometimes to places that are hard to keep something refrigerated for a long period of time. Traveling with expensive medicine that you could potentially have expire on you unexpectedly introduces a whole level of stress you don't need to introduce when you're traveling as it is, and getting on planes and going through security and all of that sort of stuff. It's very tough to try to travel a normal life and maintain your medication regime. I would say so that's probably the biggest thing. If we could come up with an easier way to inject as well, it's not just about temperature control or frequency.
Right.
Subcutaneous injections with a whatever 1/4 inch or so needle is never fun. I would say that's it. Those are the top items for me.
Yeah. Well, thank you very much, Chris. Cindy, again, thinking about, what might be, important and, what you would want from a treatment, or if something were to become available, what might be that, top most important aspect that you would think about and consider in making that choice to use a treatment. What stands out to you?
For the older population like myself, I would like to see something that could actually repair some of the damage that's been done. I'm one of the few that has cardiovascular calcifications and other soft tissue calcifications. And so right now I'm in this catch-22 where for my peripheral vascular disease, I need to be walking. But with my HPP, my spinal stenosis, I can't walk at maybe 300 feet at a time. And so the ability to fix some of that stuff, to be able to walk as exercise, not just through the house, but as exercise is really important to me. And of course, brain fog, even though Strinzig's helped with that, I still struggle with that, especially when I'm tired or stressed. I get a lot of brain fog, and I don't want to go back to where I was with that, and would like it to be better.
Yeah. So Cindy, when you're talking about first, being able to exercise and be active and continuing to do that, what would be your, if you could say, as long as I could do it this much, or if I could do it this much more, this is what, would make an impact in my life, does that make sense? Is there something you can say that gives us some idea of what you're looking for?
On a personal level, just my goals, like we had a virtual 5K a while back. And so my goal was to get 1,200 steps a day. So, all these people talk about they get their 10,000 steps a day and they're so
Yeah.
happy, pushing 1,200 steps. I usually get 300, 400 a whole day. So
Okay.
pushing that 1,200 steps was a major accomplishment.
Mm.
And I would, my vascular doctor wants me walking a mile every day, which I don't think that will happen in my lifetime, but it would be great if it could.
Right. Sure. Well, Cindy, thank you so much. Pat, how about you, thinking about what represents, an important feature of a ideal next treatment?
Right. Well, of course, I'm not on Strensiq, but the meds that I do take have side effects. I'm an non-insulin dependent diabetic. So every time I have steroids, my blood sugar goes up. And I cannot take the meloxicam indefinitely because I become hypertensive. So whatever drug is available for me would be, not only would it reduce the pain and the joint symptoms, but also safety and efficacy. Those would be the most important things. Fewer side effects and work to both increase mobility as well as to reduce the pain.
Right. So kind of thinking about what represents that benefit in terms of either reducing pain, increasing mobility, what amount of that would you need for it to, make it so your quality of life is better?
Well, again, enough so that I could obviously walk greater distances, ride my bike again, and do more extensive activities at the gym, none of which I'm doing right now.
Okay.
So that would be my goal, right?
Sure. Yeah. Well, thank you so much, Pat. And for Zoom here, we'll round out and come to you, Elizabeth. Would love your thoughts on what you would like to see in a next treatment.
Yes, I agree with most of what everyone was saying, especially the reducing the frequency. And also for me, I think it would be finding an easier way to administer the medication, whether it's through an auto injection, such as like a EpiPen, something that is a quick release, so that it makes it a lot more easier, especially when dealing with children, so that it's not like a long lasting effect, but just kind of like a quick tap and they receive the medication.
Yeah, and that would just be helpful, to make the whole need of, I think I forget if it was you that used this term, but like the bear hug,
Bear hug, yeah.
make that whole process easier for the patient, for you as the parent, all of that.
Yes.
Yeah. And then anything in terms of goals, because I know you're still still young, and you're kind of we'll see over the course of time how treatment is helping, but whether it's thinking about that treatment or any treatment that might come, what is your hope for what the actual treatment benefit will be for him?
Yes. My goal essentially is for him to live a normal life without fear. At the moment, I'm constantly afraid that he'll get hurt while jumping, running, climbing. They're at that age right now. And so, not having to feel the need of adding padding or protection or rubber mats on the floor, just being able to know that he's on a treatment. His life will be as normal as everyone else. He'll be able to play, participate in activities as other kids, just without restrictions. And, even though there are restrictions right now, just knowing that, hey, there are restrictions, but there's a different alternative on how to do the same thing or do it in a different way. And just building that confidence as kids grow. We're here to help them and support them through their journey. And I listened to Kate and Morgan talk about the, self-esteem as teens and growing up. Those are things to look forward to. But, I just, you want a normal life. And I'm happy that there are certain things set in place to help with that. But in the future, just normalcy without restrictions, without fears is the ideal place.
Well, thank you so much. That was very well said. And I just want to thank our whole Zoom panel for all of your contributions throughout this whole discussion. It's really helped us, understand the current treatment landscape, but also just really appreciate those very personal and insightful thoughts about future treatments. So I do see that we have quite a few people writing in with their thoughts about what they'd like to see from future treatments. So I'd like for us to spend some time digging into those, and we'll turn to Deborah to walk us through what we're seeing.
Sure. So Jennifer from Florida says Strensiq helps a lot with the pain and other issues like brain fog, but 6 injections per week takes its toll. I hope a different administration of the medicine will be developed in order to address the lipodystrophy. I also hope someone determines what the high levels of alkaline phosphatase cause in our body due to treating with Strensiq. Allison from California, I would love it if there was a pill format or other. The injections are so painful. I would also love to understand the long-term effects of Strensiq on adults. Taylor from Houston, Texas, anything to help with tiredness and to help with muscles, help muscles to have energy and strength. Brad from New Jersey says, I'd like to see an option for mild adults, especially people like me who are carriers but have a persistent low alkaline phosphatase and are having issues with mobility and increased pain as I age. Catherine from Aldie, Virginia, I'd like to see more pain management for those of us with less severe HPP. Then from Susan in Oro Valley, Arizona, there needs to be additional treatments that can deal with low ALP and other vital organs in the body besides bones. Tracy from Tucson says, develop an aspartase alpha patch, removable. Another Arizona, Sue from Arizona, I'd love to see a new treatment that reduces the joint stiffness and tendon calcifications from happening. So if I do fracture, I can still be busy with my hands working on crafting. And then Suzanne from Pennsylvania, I'd love to see a treatment option which does not require refrigeration. Having to keep our medication at a consistent temperature is a constant worry. Traveling is stressful or not possible.
Absolutely. I want to thank everybody who's been writing in with these comments as well. So insightful. And Deborah, I hope you don't mind if I put you on the spot. I know you've been here helping moderate and lead this meeting all day, but also as a caregiver yourself, I'm sure that you have thoughts on this final question of what would you want to see in an ideal future treatment. So this is not at all scripted. I'm putting Deborah on the spot just like I put all of our Zoom panelists and everyone else. What comes to mind for you?
Yeah, I mean, I think that the patient's voice was heard. I think that a lot of my issues are reflected in their concerns. The persistent levels of high alkaline phosphatase is something I know many of us are concerned about and what that ultimately does. And then potentially, I'm also just concerned over time about running out of injection sites. As you heard from Cannon and from several panelists, the injections can take a toll over time, and we just, as parents and as patients, wonder, if that's sustainable long term. So another form of administration or another treatment approach is welcome.
Absolutely. Well, thank you, and thanks to everybody who has called in, written in, joined by Zoom and pre-recorded, just because today has been so tremendous. We're now kind of concluding the portion of the meeting where we're asking for you to share your experiences, and we're going to work to now close out the meeting. But just as your meeting moderator, I can't say enough of just how tremendous this was today. You all were so brave. Things that coming in, I had learned from working with soft bones, are things people just don't talk about or haven't talked about. And today you pulled that curtain back and really showed us what it is to live with this condition. You were brutally honest with us about, what that is, as well as the range of treatments, both, honest in terms of where it's helping, but really importantly, what the remaining needs are that you have. And I know It's not always easy to talk about, those more negative aspects, of living with the condition or of the treatments that you do have, which so many of you did describe getting great benefit from. But if we didn't hear that other side of things, what is hard and what, you all have to persevere through each and every day, we wouldn't know how to help you and what to address. And so that's what today was all about. And I just want to thank you from the bottom of my heart for stepping up and sharing that with us. So at this point, we're going to move to some summary comments from my friend and colleague, Larry Bauer. Summary remarks are basically an impossible task after the many hours we've spent learning from you today. But Larry is a great person to do this, as he is someone who has worked a long time to listen to patients. He is a nurse by background, worked at the National Institutes of Health as a clinical research nurse for many years, and then went to the Food and Drug Administration, where he co-founded the Rare Diseases Program within the Center for Drugs, and worked in that program for 10 years. After which, leaving the FDA, he has been an integral part at helping lead these externally led PFDD meetings and has been a team member helping plan this meeting as well. So without further ado, Larry, take it away.
Thank you so much, James. I appreciate it. And like James said, I'll try to provide a very, very high-level overview and summary of the meeting. I apologize in advance for any of the details that I do miss. I cannot talk about, this was a very complicated topic and very rich. So I'll do my best to hit some of the things that impressed me. So this morning, our meeting was opened by our co-moderator, Deborah Fowler, who's the president and founder of Softbones, and the mom to Cannon, who's living with HPP and who we heard as a panelist later. This was followed by a presentation from Dr. Patricia Beeston from the FDA's Office of Tissues and Advanced Therapies in the Center for Biologics Evaluation and Research. Dr. Beeston shared that PFDD meetings provide insight for the FDA to learn from the experts, the caregivers, and the people living with HPP, and that this helps facilitate treatment development, design clinical trials, and review new potential drugs for HPP. She shared that volunteering in research is a big decision, but it's a contribution towards developing new treatments for HPP. Then we heard from Dr. Michael White, who's a clinical expert, and he's from the Shriners Hospital for Children and the Washington University School of Medicine at Barnes-Jewish Hospital. He talked about that HPP is a heritable disease with approximately 400 literature cases, and it affects all races. There are about 450 different defects, and it's a heritable metabolic bone disease with low serum ALP activity, and it's considered an inborn error of metabolism. Many of the symptoms, as we'll hear, we heard later, are not related to bones, but include metabolic effects that can be variable. And there's a broad range of severity. The more severe forms are autosomal recessive, and the milder forms are either autosomal recessive or autosomal dominant. The earlier onset tends to correlate with increased severity. The perinatal form is severe and can result in respiratory problems in stillbirth. The infantile form occurs before 6 months, and about 50% of those children succumb and die from the illness. The childhood form is diagnosed after 6 months and includes skeletal disease, short stature, and loss of teeth. And there's an adult form, and these folks develop stress fractures and bone pain. And the odonto form has premature loss of teeth, but no skeletal abnormalities. He talked a little bit too about the enzyme replacement therapy, aspartase alpha, that's FDA approved for HPP and is targeted to bone issues. Quality of life is greatly impacted by people with HPP, and the community continues to have an unmet medical need for better treatments. We moved to listening to and learning from our panelists. Our first panelist in the morning talking about symptoms and impacts was Lakin, who's the mom to Rowan and Reese, who are ages 2 and 9 months. And they were both diagnosed with HPP via amniocentesis. Rice is less severely affected, and Rowan is affected in all his long bones, and both boys are in the 15th percentile for height. Fear and anxiety have been significant for both boys related to treatment and how HPP may progress. Then we heard from Becky, who's mom to Juliana. She developed migraines, back and neck pain, and constant vomiting. She required soft food due to losing teeth. She had speech delays, ADHD, dyslexia, and expressive language issues, and she's a very smart young girl. School accommodates her challenges, and she needed a double tibial osteotomy in second grade and suffers from medically related PTSD, which can lead at times to episodes of rage. Next, we heard from Ellen, who's living with HPP and caretaker of her sister, Sue, who also has HPP. Sue started having fractures at age 3 and spent months in casts. Her lung function is affected due to weak rib bones. Ellen deals with pain in the neck, hips, ankles, back, and feet, and some days can hardly walk. And she also suffers from fatigue, which we heard from many people. Sherry is mom to 18-year-old Maya. They have 3 people in their family with HPP, but the symptoms really vary. Maya's health declined when she was 11 years old, experiencing fatigue and pain, which were resistant to treatment. She also had autoimmune problems. She has struggled with migraines and fatigue and stated her classmates, they didn't believe her and bullied her. She's felt totally isolated and anxious and has missed a lot of school. She's had countless bone fractures and injuries, and she just wants to feel better and feel more normal. And lastly, in the morning, we heard from Amy and Suzanne, who are identical twins living with HPP. Amy cried a lot as an infant and spent a month in the hospital. They both lost teeth, had dysautonomia, and depression and anxiety. They've had bursitis, tendinitis, and multiple broken bones, scoliosis of the spine, and disc herniations. Their symptoms also include tinnitus and eye cataracts, sleep apnea, and severe fatigue. Amy, when she was diagnosed, wondered if the main cause of death for people with HPP was suicide, just because of the severity of the symptoms. So we've learned that HPP can affect many body symptoms and presents differently with varying level of symptoms. We've learned that only some people with HPP have bone symptoms and that many other symptoms and health effects are experienced, including many forms of chronic pain, fatigue, brain fog. And some of these symptoms are clearly a direct result of the condition. For example, the pain, fatigue, fractures, breathing issues. And yet there are a wide range of non-bone related symptoms that the research is still out on. This has shown us that in a rare disease that hasn't been researched to a great extent, that patients and their caregivers have to live every day with uncertainty, questioning whether any given health issue they're having is or is not a result of their HPP. And they don't know how these symptoms will change over time. And we heard again and again that this is a real burden to live with HPP. In the afternoon, we shifted gears a little bit. We talked and focused on treatments for HPP. Our panel, on the panel, we first heard from Amy, who's mom to Aubrey, who's 9 years old and had severe infantile HPP. She's been on Strensiq, but it has been challenging to find the right dosage. She receives PT, OT, and feeding therapy. She's had 15 surgeries and many procedures. Amy says, as other treatments become available, I can only hope that the treatment options have less of an impact on her everyday life, her mind, and her body. Then we heard from Deborah, who's living with HPP and was diagnosed in her 60s. She takes injections of teriparatide. She limits activities as a coping strategy, excuse me, and exercises to help to stay mobile. She's not sure how the medication is working, but she said she'll learn more with an upcoming DEXA scan. Next, we heard from Susan, who was diagnosed with HPP at 3 months of age and was not expected to survive. She had internal rods surgically implanted in her long bones and needed to be in a spica cast for 3 months, but she continued to have fractures and needed additional surgeries. She takes Strensiq, which really helped with fractures and muscle tone, but it has challenges with traveling, and she's developed lipodystrophy at injection sites, which we heard from numerous people. She'd like to see a treatment that treats more than just the bone symptoms. Next, we heard from Sally, who's living with HPP and lost a sister before the age of 2 to HPP. She's taken Strensiq, which has benefited her with no fractures since starting it. She takes Fioricet for her hydrocephalus, which helps with the migraine pain. She uses PT, massage, and some chiropractic care. She'd like to have an oral medication or even a gene therapy. And our last panelist of the afternoon was Cannon, who's 17 years old and was diagnosed with HPP at 18 months of age. He's had bilateral knee and ankle surgeries and has had PT his entire life. He was in the Strensiq clinical trial and currently injects 5 times per week, which helps his symptoms, but he's running out of sites. He's had injection reactions with his throat closing, chills, and shakes. And Cannon worries about his future and what will happen if he runs out of places to inject and can no longer take his medication, or what happens if he has another reaction. So in the afternoon, we heard that the enzyme replacement therapy is often highly effective. Although the enzyme replacement therapy treats the bone symptoms, there still is no completely disease-modifying treatment for people with HPP. People would like to have a treatment that did not have to be injected, or maybe there was a different form of injection like an EpiPen, and that many of their symptoms that include things like mobility issues, pain, dental issues, sleep problems, seizures, headaches, depression, anxiety, these are treated with symptomatic treatments with varying success. And many people have had surgical procedures and use a variety of assistive devices like orthotics, braces, and canes. And we heard that PT and OT are often used, and exercise has helped a lot of people as long as you don't overdo it. So at this point, I would like to turn the meeting back over to Deborah, who will help close out the day for us. Thank you.
Wow, well done. Thank you so much, Larry, for that summary report. Well, this has been an incredible day, hearing personal insights to help us all better understand hypophosphatasia and its impact. Thank you to the FDA for giving us permission to hold this meeting, and to the staff who tuned in today. A special thanks to Shannon Cole and Karen Jackler from the FDA who guided us through this entire process, and to Dr. Beeston for your presentation. And thank you to Dudley Digital Works and the whole team here for all of their work and help with the meeting. And a special thank you to James Valentine and to Larry Bauer, and also to the entire SoftBones team. But a huge thanks goes to you, our HPP community, and each one of you who shared your experiences, and those of you who wrote or called in, giving your insights. This meeting would not have achieved its goals if it wasn't for you. Today's meeting will be available on demand right after we conclude on the same website you're on right now. The web link to submit comments is open for another 30 days. So if you watch and you have additional thoughts that you want to make sure are included, please consider submitting those comments. All of today's input will be captured in a Voice of the Patient report, which summarizes today's meetings and will be available on our SoftBones website as well as on the FDA's website. Thank you to everyone. The impact of this meeting will be felt for years to come. Have a great rest of your day.